Think about your body a bit like a car. It's got to be looked after. It's going to go wrong from time to time, so you take it to the garage.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
Where are you talking about? Is it the skin, the vagina?
Right there, like a little paper split.
Okay.
Who was it who you hit?
My friend, who's the security guard. He does that thing.
Yeah.
And he doesn't want to climb them and kill her.
What is that, Jones?
At 10:30, Dr. Opong. Opong. O-P-O-N-G.
OK, bye. What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
OK.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel like that I'm going to pass out.
Tell me about when you go for a wee.
It's very uncomfortable when I go to the toilet.
Around your groin or the testicles or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can. Oh.
Is it tender at all?
So you said you're having bubbling urine?
Yeah.
Come on in, Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared, because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard. I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that, you know what I mean?
So let me just check that I've understood this right, Brian. Yeah. So at the moment you're finding that you're feeling a lot more tense and angry at the moment at the world.
Very angry, that's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's right. That's what is causing it mainly.
Okay.
Because
Do you think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people. No. So is something making it a bit harder for you to tolerate people at the moment?
Yeah, that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, you know, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, you know. You know, and that's it. He does that thing.
Yeah.
And he doesn't want to climb them and kill the
The NHS computer system is absolute crap. I can't get into my computer. It doesn't like my...
No, that's your what you go on at the beginning, isn't it?
Yes, well, that's what I was trying to get in on that.
That's not that one.
Yes, it is. I can't understand starting late.
Now it's doing it. That's your card code.
That's the number I always do.
Yeah, so you're going into it now.
No, we're not. Not yet. Don't be so optimistic. You're not in until you're in, Chris.
All right, so... Yeah, you are swollen, aren't you? OK. I'm just going to lift up to see underneath. Where was the cut you saw?
Just right about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yep, that's absolutely fine, Doctor.
OK.
OK, then.
All
Thank
right.
you very much.
Mind how you go.
Cheers.
Bye-bye.
Don't touch anything.
No, not until I can see it on the page.
You're in.
No, it's not yet.
It is.
Not yet. Wait.
It's in.
Why does it do it?
I don't know, it hasn't done it for me.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit
Well,
more?
that's why I've come to see you, really.
Yes.
We need something to sedate me or, not to put me out like that,
Yes.
But something milder, if you like,
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took a Lanzapine for a period of time. That's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing which should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. I don't want no convictions or no violence at all in my life. I don't want to shoot someone, like my doctor or anybody.
Well, yes. Say ah for me.
Wide as you can. Say ah. Okay, say ah.
Look at me.
Say ah.
Good.
Say ah for me.
Look up for Daddy. Show him the back of your mouth. Say ah. Ah. Roar again. Say ah. Okay.
Say ah again. Okay. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, eh?
The TV and all that is a voice, So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space.
Okay.
And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
You get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up here.
But you're not thinking about doing it.
And your knees.
You're not thinking...
And your knees,
right.
and stabbing the knife in your leg,
right.
and saying, here, feel that, you twat, you know, feel this, and all this, you know, which is dangerous and self-harm, right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me. No.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that'd be great.
Okay. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, you don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
Okay.
Okay.
Well done, mate. It's all good, you know.
Indeed. All right, let's help you gather your things up. Right, Ryan.
Thank you very much.
All the best. You're going to be okay finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
How can I help you today?
It's got a bit of a lump under my chin. You can have a go on it if you want, it's just there.
Yeah. To me, it doesn't feel like anything sinister.
Cool, thank you.
Come and have a seat. How are you?
Okay.
Okay.
Fine. I feel fine in myself, yeah.
We had some results to go through. Is this why you've come?
Yes.
I hope so. Yes. I tested you for diabetes. No signs of that. Blood count, no anemia. Kidney function, fine. Cholesterol level, no. It's 6.7. The upper end of normal should be 5.
Okay.
It's a measure of the sort of fat that's floating around in your body, and we get excited about it because we know it's one of the big risk factors, fat and blood pressure and smoking, for heart disease. I suppose the first thing to say is, what's your diet like? Vegetables.
Yeah.
Vegetables and fish.
Vegetables and cakes.
Got to have some naughty days. You can't say no to cakes completely. But actually, cakes are what we call quick fixes. You get a sudden burst of sugar, but it doesn't last. If you were to take your carbohydrates in the form of something like, say, porridge in the morning, that'll keep you going because it's releasing the sugar slowly. So porridge, cereals, pasta, they're all releasing their sugars slowly.
If only there was a magic potion or something for weight, eh?
Yes, there's no magic wonders for weight. But diet, losing weight and exercise can actually reduce your cholesterol levels.
Yeah, I know exactly what I should and shouldn't be doing, so I'll give it a go and I'll try.
Give it a go. You can actually get 12 weeks of free Weight Watchers.
Wow.
Just think about it.
Yeah, definitely. I can see you.
Okay?
Okay, see you soon.
Good, bye-bye. I hope she does something about it.
All right, so that's 5 o'clock then. Okay, thank you. Bye-bye.
I've got my thing tonight, innit? My Weight Watchers start tonight. Excuse me, please. This is my area. I can't breathe. That's why you go Weight Watchers. Oh, leave me.
And my stomach, yes, most times there's pain in me. Yeah.
Do you get any feeling like being sick, vomiting? Or...
No, I just feel pain. I'm feeling pain.
How's your weight been?
My weight is all right.
Yeah. And how about your appetite?
Yeah, it's okay.
Any diarrhea?
No. Blood coming out sometimes.
Blood?
Yeah.
Is it in the toilet bowl, the blood?
No.
So it's only when you're wiping?
Yeah.
Yeah. Because of the symptoms you're having, would it be okay for me to examine you?
Yeah.
So I need to check your stomach.
Yeah.
The other thing is because you're having bleeding from your back passage.
Yeah.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
No.
Okay. Now I'd need to take a look at your back passage. And obviously I'd have some gloves on. And then using some gel, I would examine your back passage with my finger.
No problem.
Okay. Are you okay for me to do that?
That's fine.
Do you want a chaperone, or are you happy for me to go ahead? Do you want someone to chaperone while I do that exam?
Yeah.
No, do you want someone to be in the room whilst I do that exam?
That's all right.
Okay, so first I'm just going to take a look at your stomach.
Okay.
For all intimate examinations, we would offer a chaperone to people. Because quite often your patients might come to the practice with a range of different symptoms and they wouldn't expect to do a personal exam because that's maybe not what they had in their mind. So I'm just going to gently press. Just a sec. Lie on your left-hand side, yeah? And then let me know when you're ready.
I have to take my trousers off, yeah?
Well, you can just lower them just so I can see your back passage, essentially. Tuck your knees up towards your chest. I wouldn't say it's difficult to do an intimate examination because it's something that you do throughout your training, so you do get used to doing intimate examinations. And that's why it's important that you're reassuring the patient that this is actually quite a normal thing and there's no need to feel awkward about it. Okay, so I'm just applying some jelly to your bottom end. It'll feel quite cold. And now I'm just gently advancing my finger through.
Yes.
Okay, so if you want to get dressed and then come back outside.
Okay.
Yeah.
I don't know what's causing that blood sometimes.
You've got a pile, which is what's causing the bleeding. Have you heard that term before, hemorrhoid?
That's what I was thinking.
Okay, so around your bottom end, you've got quite a lot of veins there. They carry blood, essentially. So sometimes when people get symptoms of, say, constipation, as such, have you felt constipated yourself?
Yeah.
You have been? Okay. So I can give you symptoms of bleeding. So there are different things you can do to try and help those symptoms.
Yeah.
One thing is eating more fibre in your diet. There are some creams that I can prescribe for you that you could apply to your back passage to try and help those symptoms as well.
Okay.
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 Yeah.
Hello, this is Dr. Ferdinand calling from St John's Medical Centre. You know, we took a couple of urine samples from you last week. They came back negative for chlamydia and gonorrhea, so there was no evidence of those.
I can't sit here and tell you that you definitely don't have prostate cancer, but at the same time, you're within normal range now, which is fantastic. You brought that right down.
They did a lot of random biopsies, and your IBS-like symptoms are just IBS. They're not colon cancer.
That's fantastic news. Thank you. Thank you.
We're in business.
Yeah, it's normal. Okay, thanks. Bye. It's normal. Your chest X-ray is normal.
So, last time I saw you, you had this problem with your toe.
That's right. And I went.
I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
okay.
Yeah.
So
it's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Diabetes is a serious diagnosis because it's such a wide-ranging condition. The fact that the sugars affect your eyes, affect your kidneys, and diabetes is in itself a risk factor for heart disease.
Right.
Yeah, it's not something to be taken lightly, but at the same time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes, plus I'm a drinker, so will that be knocked on the head or...?
What do you drink?
Mainly lager.
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially a pint of lager.
I thought that, yeah.
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites.
Yeah, so
because that's my living. I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars, because I mean we're talking about the rest of your life, 30 odd years. We need to get this diabetes under control, and it will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. I'm going to give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control.
Do your fist for me.
Now I've got to pinch an inch. All right? Keep your belly nice and relaxed, okay? Very good.
All right, sharp scratch.
Right. Any allergies to anything that you're aware of?
No.
High blood pressure?
No.
High cholesterol?
No.
Thrombosis, clots in the legs or the lungs?
No.
Diabetes?
No.
Glaucoma?
No.
And breast cancer?
No.
Have you ever had HIV screening?
I think I did, but it was years ago.
Right. Do you want me to do it today?
Yeah.
Yeah? Let me feel your hands. Are you warm? So this is an instant result.
All right.
1 dot is negative and 2 would be positive.
When I had my eyes tested and he's in there saying to me, well, you could do with losing weight. I said, yeah, mate, I'm 66.
Yeah, oh no.
Can't be doing no donuts. Mate, no. Nice to see you anyway.
Thank you. I haven't seen you for a long time.
I don't come here a lot, do I?
I don't blame you. Take care. See you soon. Bye.
There you go, you've got a nice negative dot there.
Phew.
It's amazing how many people suddenly think when you say to them, oh, it's a test, you can have the results straight away, they go, oh, OK. What, you mean now? What about chlamydia screening? Have you had chlamydia screening recently?
Not recently.
Do you want to do that as well? You can do that yourself.
Okay.
What you do for that is you just go to the toilet, wipe yourself, pop that much into the vagina, woohoo, and then in the pot.
Okay.
All right, and the toilet's right opposite.
Hi, is it Miss Strong? Hi, please come in. What can I do for you?
I'm here about my Coil.
Okay.
I've had him over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had
Fine. I mean, the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case.
post.
So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
I've had the menopause.
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it difficult. But that's some people. Yeah, the menopause affects people in various different ways.
The hot flushes, I'm not really too bad on that. I might get the one maybe a month, if that.
Yeah, no, I don't get the hot flushes.
So I don't get the hot flushes really and truly. I don't experience that. But what I've noticed with myself is that I'm so snappy.
Yeah, me too.
Bad-tempered.
Yeah, me too. Yeah.
It's like I want to kill anyone who gets... It's not even funny because it's like... I have to check myself sometimes.
Yeah,
do you know what I mean?
Of course. It's not sure somebody will say to you, why did you do that? And you think, did I?
Don't know
that you did.
It's got to be menopausal.
Yeah.
Was there anything else you wanted to ask about? Was that it today?
What's this up? I noticed that I keep having, my vagina in there. You know that bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
What? Rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay, and does it bleed?
No.
Is it just very sore?
Mm.
Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink, and you can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or irritation, things like that.
Yeah.
Does that make sense?
Yeah.
All right.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I've got a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
Okay. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes, so it's the pain that you can make worse by touching it.
Just by touching it.
Right, may I check your blood pressure, please?
Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar, I've never had them before.
Is there anything else going on in your life that you...
I'm just down all the time, constantly. And I'm going today to, would you call the people the psychologists?
Yes. Are you worrying about that?
It seems strange, do you know? I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that. Do you know what I mean? I feel a bit worthless and a bit silly.
OK. We could look at it a different way round, though, couldn't we? Think about your body a bit like a car that has to be serviced. It's got to be looked after. It's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah,
and the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong. It's just a little bit of a loose this, that, or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons we thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse?
You know, this headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first
underlying
place.
Thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope.
Seal it up.
And seal it up. OK? And concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what I mean? And I
yes.
think, well, I'm going to be 69 this year and I still feel quite good. Do you know
Absolutely.
what I mean?
Keep on with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Not bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes. I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Mm-hmm.
Is it hard?
Sometimes.
Yeah.
Yeah,
Okay.
sometimes.
What's happened recently to make this the worst day of your life? Okay. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Now, he can be a bit squiffy for a few days with this, all right? So if he's a bit loose, don't worry.
You've got such a hard life.
Oh. Right, so sit him like that, nice and relaxed, yeah?
Yes.
Okay.
I'm trying to be.
Well, you're doing very well.
Right, I'm not going to look. So
No,
tell
just
me when you're doing it.
Relax, just relax, okay? He's going to...
My heart is beating.
It's all right. All right. You're doing well, you're doing well. There you go. It's all done, look, see? Oh. When somebody wants me to hold their baby for them, I can feel just as nervous.
Okay, have you got some tissue, please?
Yes, darling. Oi, mister. I'll get away with you.
All right, Mummy's sorry.
4 weeks' time.
What's he got to get done then?
He has his second diphtheria, tetanus, and his meningitis C. And he has,
injection?
yeah.
Gosh, I can't do it.
Look, he's all right now. He's just whinging now. You're fine. Man up. Come here, give us a cuddle. What you like? What you like? Hey? I've always been able to communicate with children. You see them evolve, and one child, she wouldn't even come in the door. She'd sit in her buggy at the door, and I'd say to her mum, just leave the door open, that's fine, she can stay there if she doesn't want to come in. And then the next time she came in and she stayed in the buggy. And then I've met that child all the way through, and now she's an adult working, and I still bump into her, and we get on really well, and I've seen her develop as a child into a young woman, and it's great. Right, what time do you want? 9:30?
That's perfect.
Are you all right there, your hand down my cleavage, mister? My dog does that.
He does that all the time. It doesn't matter who it is, he does it.
You've got to let them develop. And that's what I love. I think they're so funny.
Thank you.
Are we going to get a smile before you go so your mummy knows you're all right? Look, he's fine now.
Did you have a problem with your medication? Uh-huh. Okay. Okay, you're welcome. Take care, bye.
Hello?
I'm still limping.
You're still limping, Ian?
Yeah.
Is it no better at all then?
No, not, the lump's not gone down at all, really. They phoned me up this morning saying, can I come back to work today?
No, you can't come back to work.
They want me back this morning.
They wanted you back?
Yeah.
Come in. Hello. So, you mentioned the lump.
Yeah.
Let me see it. So whereabouts do you feel your pain?
Just round there.
Just round there?
Yeah.
OK. It's been a little over 2 weeks now, and the pain's no better at all. If you come lie down, I can work out whether it's your hip or your knee that's causing the problem. Right. So, bend your knee for me. Hang on. Relax. Just relax. Let me move your knee. Can you bend your hip a bit more as well?
No.
Does your hip come up any higher?
No, that's how high it comes up.
That's as high as it goes. All right. Does that hurt?
Yeah.
Can you sit? Can you sit on the edge of the couch? Might be easier if we get you to sit. Great. That's all right. Just. Oh, does that hurt? Sorry. Yeah. Let's get you up. Sorry.
That's all right.
Didn't mean to cause you discomfort. I think the problem's your hip, Ian. Because your knee seems to be moving quite well.
Yeah.
and it's your hip that's actually really struggling to get much movement out of.
Yeah.
Would you agree with that? Or?
Yeah.
I think maybe we should get you referred to see the specialist about your knee and your hip.
Right.
All right, Ian. Yeah, do you want a tissue?
Right.
I'll take it you're not too keen on the idea of having to have further operations.
Oh, I'll be right. Last time they said it was 50-50.
Hello, it's Dr. Parker here at St John's Medical Centre. Right, he said he did want to have counselling, and I genuinely believe he hasn't been taking crack since then. He still takes cannabis, but then a third of the people that live around this surgery take cannabis, so that's nothing new.
Okay, but it's really important you try and avoid the marijuana. The strong stuff or the weaker stuff, it's still best to try and avoid altogether. Okay, take care. Cheers, bye-bye.
If you want to try to avoid an operation, then the thing to do instead would be to have some physio and seeing if that helps.
Yeah.
But unfortunately, arthritis tends to be progressive. It tends to get worse with time anyway. So, I mean, would you like to try some physio first, or do you want to be referred for...
I don't mind being referred to see the doctor again.
You'll see the doctor about maybe having the operation?
Yeah. Can I go back to work yet? Or not?
At the moment, do you think you'd be able to manage the pain?
No. They wanted me back this morning.
I know. Maybe if we give you a couple of weeks more off, and that gives enough time for hopefully the knee and the hip to settle down a bit more.
They want it straight away, they said. They won't get paid otherwise.
I'll take that then, quick. So that covers you from the 10th up until the 24th.
Yeah.
Yeah, I'll get the paperwork sent off. I'll ask them to see you as soon as possible. Okay?
Yeah. Bye-bye.
Bye-bye.
Thank you very much, Doctor.
Take care.
See you later.
Bye.
Mr. Tappenden, hi there. What can I do for you today?
Yeah, basically what it is, Doc, I'm a diabetic, so you know, my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or 6. I mean.
Yeah. So they really have shot up.
Yeah.
You've had quite a few urine infections. Is that right?
Yeah, on and off. Yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning sensation,
It burns?
Yeah.
Okay. And are you peeing more often than normal?
Yeah, more often, yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in
No,
it
it's
at all?
not blood.
Right.
It's not blood.
Any cough or
No.
difficulty breathing, headaches?
No.
Rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No. Yeah, they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait and take it from there, okay?
Yeah.
There's a lot of glucose in your urine.
Yes, sir.
But there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although it doesn't, I don't think that's what's happening.
No.
All right?
Okay, yeah.
Take care.
Okay.
Nice meeting you.
So I just need to examine her?
Yeah, that's fine. Hello, cheeky.
Think of the 3 pigs and the wolf outside going, huff, puff, blow your house down. That's the house. In. Get out of it. Try again, go on.
And if you were going to score it, say 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion.
Easy!
That's it. Well done. Well done.
Hello.
Yeah, please.
Jordan, this way. Jordan, no, this way.
What's up with Jordan today?
Right, I've just got a little problem. His way he's behaving. I'm just wondering, has he got some form of autism? I was reading on the internet that kids that line their toys up, line up their toys, because he does it like all
Lining
the
up the
time.
toys. Okay.
And he knows all the planets. You know, he just lined them up. Jordan, no, come this way. Jordan.
Okay.
Sit down. Okay?
What else?
And sometimes he's like this, he just laughs unconditionally.
No.
Jordan, can you stop?
And how does he get on with the other kids his age?
Fine. Teacher said he's fine. You know, Jordan, can you stop, please?
If Jordan wants something, can he tell you about it? Can he tell you, I want this
Yeah.
book, I want that book, I want to watch this, I want to do that, I need something to eat, I need something to drink?
Yeah.
I mean, you're right, autism is a spectrum. It goes from very severe to barely noticeable, to be honest. What you described about being quite obsessive about one thing, that ritualistic behaviour of lining things up. Those are 2 features of autism.
Yeah.
But there's also features of normal 5-year-old kids as well. Okay. The internet has a really interesting role in healthcare. I think once people have their diagnosis, it's very easy for them to then go away and research what the treatment options are themselves, and that's great. I really welcome that. I want my patients to be really well informed about their conditions. But I think the one thing that the internet's not very good at is diagnosing. Usually if a patient has tried to diagnose themselves on the internet, I'd say 9 times out of 10, they're probably wrong. Autism is a social communication disorder. It's your inability to be able to interact and socialise with the world around you.
Yeah.
It sounds like he does fine.
Yeah.
To line up the toys, that's every kid does that. Lots of adults do that. We all line things up just because that's the way we are. It doesn't make us autistic, it just means that is a little idiosyncrasy of some people's behaviour.
Yeah.
He seems like a pretty normal
5-year-old.
to me.
Okay.
All right?
Thank you.
No problem.
Jordan, come on, time to go. Say thank you to doctor. Thank you.
Bye-bye.
Bye.
It's time for the weekend.
Right, I've put that in for you. You're welcome. Okay, bye.
This patient was so happy that she got an appointment at the time that she wanted, but she goes, oh my God, thank you, darling, God bless you. What are you doing this weekend? Watching my TV with my teddy bear.
Hot off the press, you can have it from us. I've got stage 1.
Okay.
Bladder cancer of an aggressive type.
So this is the speculum going in, okay.
I want to stop drinking. I just detest it enormously. Yeah. I'm being honest, I cannot stop. It's as simple as that.
Let me just dip this sample.
Yeah.
Keeping it really simple, left hand, as you find right hand is... it's mentally exhausting even just to do that.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you have a look at it, but
Yeah.
it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've had that.
Right.
But it's very much like...
So, let's just have a look. So, it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's got
at
neither
all.
worse nor better. It's
No.
just,
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not
Yeah.
itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently,
No.
or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door,
Sure,
who's our
yeah.
skin guy.
Yeah.
Do you mind if I just quickly see if he's
Absolutely.
around? I won't be a second. Can I just really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with this is Dr. Mackenzie,
Hello there. Hi.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. Are you not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked
stuff
that.
came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. You know, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, the sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah,
about
that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
It looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallowed. Do you know how many
put
tablets?
a note in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and it makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right. Come in. Hi.
Charlotte, is that Yeah. right? Hi, I'm Dr. Rose. Nice to meet you. Hi. This is Laura. She's a healthcare assistant who gives us a hand. So, time for the coil. You're looking forward to it. Dreading it. Yeah, I know it hurts. Because you've had it done before, haven't you? Yeah. And you're keen to do the same thing again. Yeah, although it hurts for the first, I found for 2 weeks afterwards, then for 5 years it's absolutely fine. So it seems like the best option of a lot of them. So this is the coil that we're fitting. So this is what it sort of looks like. Basically what we do is I'll use a speculum, which is the thing that opens up your vagina so we can see your cervix. And then what I'll do is I'll remove the coil that's there at the moment. Okay. We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb. Someone told me their friend was born with, their friend's baby was born with a coil on their head. Yeah, it does happen. I've heard of something. The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb,
There's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This
Have
is
you
never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
Okay. Hello. Register baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Alice house, come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on.
Great.
So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? He's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And
quiet.
he's like,
should we have a look? Is that okay? Can you unpop him?
Yes.
And just roll yourself. Now, can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but
okay. Let me have a listen before he starts crying. Because it's not. Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold.
Bear with me 1 second. Let me just have a good listen.
Kate, isn't it? Have a seat, Kate. I'm Louise, one of the nurses. Rightio, you're here for your pill this morning.
I just need a repeat prescription for my pill, actually.
Okay. I just need a repeat for my pill.
Just looking to go back on the pill again.
Have you had thought about any other types of contraception?
I have. It's just, at the moment, I'm just carrying on this.
I did my test, pregnancy test, and it came that I'm pregnant. Because I was on mini pill, so, you know.
So you weren't planning on getting pregnant?
Not really.
No.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coil.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Hey,
Sorry, do you mind if I hold you?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
Is it a nice big cough for me?
Cough.
There
okay.
we go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp.
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah. Yep. So this is the coil going in now, okay?
You all right?
Is it in?
Yeah. Yep.
You've done really well.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't.
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's 18.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay, okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. Yeah. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around in the bedroom. Perfect. That will be useful. And you can get. I mean, they're very little at the moment for saline sprays, but you can get sprays for the nose that helps from the pharmacy that help clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were, or he's still not as alert, or things are not improving, or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday as it came on today?
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No? Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You all right?
I'm seeing number 8. I'm
Sorry.
I feel terrible. I've got a deaf in one ear for start,
Okay.
which I don't know why. I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do, remember last time you had that cyst?
Oh yeah, got
Just
that.
wanted to have a wee look at that. If that's
Well,
all
the
right.
antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that, really. That infection has settled down and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we?
Okay.
So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is.
Yeah.
I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah, okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can
You could do,
it?
yeah, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see on, I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care, all right.
I'll see what I do.
Yeah, all right. Look after yourself. All right. Cheers. I referred him to drug and alcohol services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him, full stop.
Three people queuing and just me, Carol and you picking up. Good afternoon.
It's okay, it's one each.
Putney Mead, how can I help?
Putney Mead, good morning, Nicola speaking.
Susan Watts, please. Thank you, come through. So, welcome. I haven't met you before and think you were booked in to have a health check, is that right?
Yes. Can I just give you the history? Then, it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes so the worst they'd ever be? So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia or anything. And
Yeah.
I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 right now. Oh, God, I've got years in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination test. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Can you close a bit?
I mentioned that
How do I get back to mine?
the car was stuck in. In M&S, and he said, yeah, there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
Oh, is he? No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Likewise. Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No. Why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2 different
right?
parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone.
Because they jumped off the car park.
Is that
today.
right?
Yes.
Gosh, that's very
Well, that's
sad, isn't
nice.
it? How are you doing?
I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Had
So
you seen the urologist?
Yes, so did you want to see us today to report
how
to
things
you
gone?
how
Yeah.
it all went? certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1.
Okay.
Bladder cancer of an aggressive type.
I've had blood in my urine since like May, let's call it, April, May.
As soon as my urine starts to go funky colours, I come in.
Brilliant. Thank you.
Is it normal for the urine sometimes to smell a little bit sort of putrid?
Well, that suggests infection, really.
Yeah.
Let me just dip this sample.
Yeah.
Oh. That wasn't very clever, but I've still got some.
When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives, and most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good. And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
Whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
In fact, you know you can do something about it, and nothing else is involved. And I think that's the important bit.
She did mention the surgeon, who's a lovely lady, that bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing two things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me. Okay, good. So you're feeling positive about it?
Yes. I don't think I've ever felt particularly negative.
No. Great.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it? Will you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good. Oh. Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great, thank you.
Far slower than I used to write.
Really, yeah, yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand. Yeah.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank
You've been
you.
so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
it makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
You lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters.
I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing is becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelace is fine.
Would you mind just
Of
tying your
course.
shoelaces for me?
It
Or
won't be-
untying
it
them?
won't be a problem at all.
I'm just looking at you using that right hand, because that command, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
And I could do that all day long.
And you can't do that at all with that hand?
So I'm commanding my hand. It's very tiring. I'm going, come on hand, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids, I can load up
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the
So
wrist.
do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any, without being extreme, doesn't feel like I've had a stroke or paralysis,
Yeah, no.
anything like that at all.
And so the sensation to you feels the same. You're not no pins and needles,
No,
nothing like that.
No, never at all. Or else I would have come. Absolutely would have.
And
come
you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Fabulous.
Thank
Okay.
you very much.
No,
Take
good
care.
to see you. All right. Bye.
Thank you.
Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks.
I've got none.
All right, rub it in, why don't you?
40 tasks. I haven't. I've got none from today.
I've got one.
Good. One. It's because I don't delete them. That's how bad I am.
I actually asked the patient to come in for.
Come in.
afternoon.
Hello, hi, is that Alexander, is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it, no difficulty breathing, nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain, actually, to be
okay.
honest. And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right,
Because it's making me feel a little bit groggy as well, to be honest. And
yeah, and what had you been doing that day or the day before, can you remember?
Been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week, in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it fluctuates, but it never affects my levels of concentration and what.
Fair enough. It's just the kind of niggly thing that's there and comes on and
goes,
lingers a bit. So if I push on it, can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That caught you. Sorry, I don't mean to make you jump off the bed. What about on the other side?
Chest itself? No,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah,
shirt on. Do you mind just putting your t-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. If it'll make a bit more sense.
Yeah, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value is ever so slightly on the higher side.
Okay.
It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe.
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way, because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation that's worse when you're doing things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests that something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're okay.
Ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case there was
I've got
any
days
doubt.
off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor.
I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Thank you.
What I've come in for today is, can you guess?
Stitches.
Take stitches
Good.
out, yeah.
I think we might have a boil or an abscess there in your neck.
Let's take this one out and we'll see what happens.
That's hurting.
Sorry.
This piece of nail, it smells bad.
Oh, yes, there's not much of a nail left.
No.
Take some deep breaths. All this is swollen, isn't it?
The red thing around is still there.
I'm not sure what that is, and I was wondering if you can diagnose it.
I think it's a fungal infection from the way it is.
Right.
Hi.
Morning.
Is it Margaret?
Margaret Coil.
Coil, yeah. I'm Dr. Bavadia. Nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist, and it just looks to me like scabies. And I bought some stuff, actually, and then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you a place on my...
Yeah, please do, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation, SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on.
Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
A difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments. So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah.
I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
It's like taking things more. I mean, I have to, but
yeah, try it. It's tolerated pretty well by people.
Okay.
All right. Take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they could just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is. But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pregabalin.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we're having a sort of intensive period of trying to get this tilt assessed more. Yeah. And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Yeah. Okay. Perhaps not the time to start changing things now anyway, but I wonder have you flown before taking these medications with you?
Yeah.
Sometimes people like a letter for those sorts of medications, which I'd be happy to, but you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. Again for you. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Are they?
Really, really well, yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy, I feel a lot better.
When are you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumor up in the air,
There is a risk flying It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please, God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so pleased.
No, they've all been given out to me. My mum, she's
Of course they would.
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been
have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you
Have a good time.
I'll see you. And if
Yep.
there's anything you want, let me know.
Yep.
I
Yep.
did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.
Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards.
Can you put your hands behind your back as though you're doing your bra?
I can't put my bra that way. That gun, will it increase my CO2 emission?
No.
I buy some, what they call Dr. Chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot.
It's making me anxious. I'm a nervous wreck. I just can't stay there.
Why not?
I feel vulnerable. The house has been broken into before.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer. Because it really hurt.
I mean, that's the most terrible bruising I've ever seen.
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, So the things like the laryngitis, typically more with a sort of loss of voice, it tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route of anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, it's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this? No.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen. Let's have a listen on your back. If you, is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just said, oh, nothing was open because it was Easter.
Yeah.
I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this hen weekend.
Can you say limiting?
Well,
realistically.
Do as you feel is right.
Okay. Is there anything else I can do?
Things, you know, sort of sometimes, you know, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It's just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really the key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you developed this infection.
All right, thank you
So,
very much.
yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, have sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday!
Come and have a seat. I'm Dr. Beecroft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
And just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. I was just like, and I've tried everything that I can possibly get just over the counter. Yep. But nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision. It makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like, I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them, out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good
Thank
day.
you.
Bye.
You too. Bye.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
So tell me what happened. Well, I was on a mountain bike and I fell sideways, put my hand out, and I still can't really bend it.
I slipped backwards as I was getting in the shower, elbows down, and smashed the decorative tiles.
Is bend it this way?
I don't think it's like broken, I think it's just like really sore, I guess, and then my head hurts a little bit.
And it wasn't that anything felt like it popped out or popped
No,
back
no
in
popping. It was definitely a rip of some description.
Okay.
Hello, good afternoon. And come in, take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
and you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in that, in and around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. All I know, I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here? No. Around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin, it's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And with the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just get it
What's it getting up to? Yeah. Exactly. Well, you can be relaxed.
Cheers.
Okay, take care, have a good evening.
I mean, that's the most terrible bruising I've ever seen.
And no other reason?
No. I don't remember.
No falling,
I mean,
no injury,
I
no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that,
it.
then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder, but this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly.
Yes.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis?
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
sun.
no more trips to
and a hat.
Ibiza.
No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Sharp.
Yes, thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. Should I just stop eating wheat? No, I'm gonna bring in my what's that tea?
Green tea.
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle, like go to the gym like 4 times a week, eat really healthily, like I don't eat any overly like refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time. Even if I'm only having like a bowl of soup, just blows straight up and it feels really tender.
Okay.
And it's getting to the point it's just so uncomfortable. And at night, like I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, okay, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems, celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
So I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer. Oh, because it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect. Thank you so much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Keep
tend
looking
to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just looks absolutely ridiculous.
Okay.
That's great. Thank you
All
so
right.
much.
Pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
Don't speak to your
I'm fine. What
Should be asking that, should I? You should be asking me.
What can I do for you?
I'm actually needs a favour. I've recently swapped into a ground floor flat.
Yeah.
And I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards. I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Well, why not?
I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough.
There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local counsellor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr. Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and the pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides. It just depends. I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, you know, then I'm sort of like
having a good yawn.
I'm having a very good yawn. Like, I'm making up for like the last 4 in one go.
Okay.
You know, with the last 4 average yawns, I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good.
I'm not a big meat eater. If I've left to my own devices, I would tend to eat a lot of beanie type things.
Okay.
I tried a very tentative with egg.
Yeah.
And she had a rash, but mainly around her mouth, and she also would vomit.
I don't eat any butter at all, apart from on toast, which is about once a week. I do eat cheese, but not tons of it. I stopped eating bacon because of this.
Do you like your milk more than your food at the moment, young man? Is that the problem?
So you thought you had put on weight, so you stopped eating potatoes.
Yeah, and just stopped eating a lot of potatoes and starch was not the thing to do. You know?
Oh, right, okay.
But I possibly went too far down that road.
And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods. You know,
it's mostly cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call hot chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, like I mean if it was like 30 gobstoppers.
When you've eaten 30 of these things, when you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. I eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out for a session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she said, fine. I haven't looked because she's just been taking her weight and all things, preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Oh, found her.
I broke my No, that's
Right.
Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, okay? Let's bring you back down a little bit.
She's a very active little girl.
Okay, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a series. Like, there's more of them.
Can I have a little look in your nose? Is that okay? Yeah? So, what's the longest without a nosebleed? A few weeks? A month, maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80. Just relax your nose. Don't scrunch it. Relax.
Is it gonna hurt?
No, it's not gonna hurt. I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating. What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, okay? 4 times a day for 10 days. 10 days? Hopefully that will stop the nosebleeds.
Be sad.
94649.
Wow.
We're happy. All right, there we go.
Lila, you've got to stop. You've got to stop now.
All right.
Thank you very much.
Bye-bye.
If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
I know.
Instead of ganging up on me?
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea brought.
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do
Hello.
all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take it away, can you?
You can't. What can we do for you
Well,
today?
what happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after day for an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor.
That's right.
To have another examination.
That's right.
There we are. Well, we can sort
Slot in
that
around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know, can they cure floaters?
No.
Kind of thing now, instead of turning my head suddenly, I might get a little arc, light flash, but I've got a floater there now, but I'm kind of learning how to put up with this.
Yes. Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment. What I'd like you to do is, on the way out, If you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here. It's like when I had anaesthetic.
Did you have swelling on your tongue as well, or just the mouth?
Not the tongue, just the
And your
mouth.
breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on there?
Feels like something's going to pop out of my ear.
Okay, nice.
You have your tea, you're not drinking your tea.
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
And when I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees?
Both knees. And
Elbows?
elbow. And when I do like that, when you do like that, I wanna,
What do you mean?
but when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, a vision. You know, sometimes I get the vision. Sometimes it's like, the light, not this kind of light, like the bulb.
Yeah.
The bulb like a zigzag, but it
A halo?
what is it? No, halo is round.
Oh,
This is not a round. It's like a zigzag.
okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe
Take-
slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really. I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press
At the back?
right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the
Yeah.
edge for me.
like somebody was bashing me. Oh,
All right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much. A little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see, oh, this one stay.
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cold. Feel my arm.
Oh yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
I'm Paul, healthcare assistant here. Come for your blood test.
Oh my God.
Is this your natural hair or is this artificial hair?
Yeah, natural hair.
Sorry, it's squirted. It's definitely a cyst from the fact that it's squirting everywhere.
I've done blood tests quite a few times and it's quite difficult to
Really?
find out, yeah.
I like a challenge. Yeah, got it.
You can have the record for most wax down your ear. Oh my God. Yeah.
Come through.
All right, I'm Karen.
Thank you. Hi.
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I've cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator and the you know, the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum. Because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah.
You're going to give it a go?
Oh, certainly.
OK, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me?
Yeah.
Thank you, sorry. I've got my colleague with me because his machine's working
Hi.
and mine's not.
How are you?
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. Okay, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you
That's
stop,
it.
that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah? So the plan of action will be, I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah.
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on, then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. Oh, I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50. So I think the way to do that is with a blood test today. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
Oh, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one. Oh, old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's
yeah.
her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah. Room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much.
Pleasure. I hope you feel better soon.
Okay,
thank you.
Okay, wonderful stuff. Take care. Thank you.
Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
Right.
Thank you very much for that.
Okay,
That's great.
nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.
It is really tough breaking bad news.
There is a risk of the back of the eye retina to detach, and that causes blindness.
One of the advantages of being a GP is to have that long-term relationship with patients.
I've got to last until my Charlie gets through medical school and graduates.
Okay.
If you can make people smile or laugh, they're able to relax in your presence. That is just the most disastrous looking toe I've ever seen.
Looking at your ECG, I think we still need you to be seen in hospital today, okay?
Farnham Surgery, £3, how can I help?
Hello, darling. Come in.
Thank you.
You saw Dr. Bolger, didn't you?
did,
Yeah.
yeah.
And she's put on here we need to repeat your liver function.
This is the best one.
That's good. Oh, yeah. It's a whopper.
Yeah.
I like that.
As long as you leave me some.
Has nobody seen this yet? Has anyone seen it? No.
No. It doesn't bother me, except if I touch it there, which is the point of contact with the floor.
Yeah. I don't check the faces, but I'd be inclined to put you in to see the emergency doctor this morning.
Maybe you'd better check it out.
I would prefer to, have the doctor have a look.
Okay.
Right, my darling. Nice straight arm.
No, he's parked right in the middle of the car park. I couldn't get into any of the spaces.
Oh.
He won't move because he's waiting to pick
What, in here?
up in the doctor's car park.
Oh.
Ah!
Emily Angel, please. Hello, come in. I'm Dr. Sheikh. Have a seat, please. Right, how can I help?
Yeah, we were here Monday.
Yeah, I did
and
see
she
that,
had the
yeah.
rash, it was just on her tummy.
Yeah.
And we were prescribed Piriton.
Yeah.
Told to just do 2 meals twice a day because she's not really supposed to have it yet.
Yeah.
But it's not working, and the rashes, you can see it's all over her face, her arms, legs,
Well,
feet,
you're still
and
smiling,
everything.
yeah. Okay.
And he did say if it gets worse to come back, and it's obviously got quite a bit worse.
Shall we have a look? And feeding-wise?
She's been okay with her milk, but not so much actual food.
And having wet nappies, that's normal? Yeah.
Wet nappies.
Okay, why don't you take off all her dress and accept the nappy? Okay.
Yeah.
Yeah, you hold it and I'll have a look at you. Okay. Apply pressure, they disappear and then they come back.
Yeah.
Now you want this toy, this is mine. Yeah? You want to be a doctor? You want to grow up and be a doctor? Okay. Okay, so you can dress her back before she gets too cold.
Yeah.
The rash that she has got doesn't look like an allergic rash. Okay, so you can stop the peritone actually, right? So it's not a worrying rash. She's well in herself. She's not got a temperature.
Yeah.
If the rash changes in appearance or if you're worried for any reason, bring her back.
Yeah.
The only other thing I wanted to mention, while I was having a listen to her chest, I did hear a little extra sound in her heart, okay, which is nothing to worry about. Again, we sometimes see this, which we call as an innocent murmur.
Yeah.
Sometimes babies, when they're unwell, they get a murmur and then it kind of, resolves on its own. But I don't want it to be missed. So I'm going to write to the pediatricians to have a look at her.
Okay.
High five?
High five.
Do you feel reassured? Yeah?
Yeah.
Okay.
Thank you very much.
Do you want to hold that? Yeah. But don't tear
it,
it and don't eat it. Yeah. You're welcome.
Thank you very much.
All right, you take care. Bye-bye.
Bye. Come on in, Sarah. I'm Dr. Bolger. We've met, I think, haven't we? Okay, so how you doing?
Levels are still a bit everywhere.
Right, because we... have you had bloods done or not?
No,
Here?
not recently.
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So they're all... There's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
Yeah, it's just everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 minutes in the morning, and then I have like between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch?
It's about 24, 28. I put it up to 28 lately.
And what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do you know why?
I'm suffering from depression as well.
He had a bit of an accident at the weekend.
Did you trip?
No, I just didn't realise my step was that big.
I did go backwards and forwards, and I said, ow, that hurt my back.
What happened?
Well, apparently I don't remember going from the top of the stairs to the bottom, but apparently my manager said that I'd fallen.
Oh, you had a fall. Oh, dear.
I fell downstairs.
At home? Oh, gosh. Come on through. How can I help?
Well, I fell and found my...
Yes?
Everybody says I have to have it checked out to see.
When did you fall?
On Saturday.
Saturday. What happened?
Well, I was coming down the escalator in the shop.
Yes.
With a trolley to turn it round. Of course, the escalator doesn't stop.
Of course.
It keeps going.
Yeah.
Taking me with it.
Oh, bless you.
And I couldn't stop myself.
Is it painful?
It's only if I touch it. It's not that painful now.
Yeah.
You know, the pain dies down. But I saw a chiropractor yesterday because I see them for my arthritis. And then I saw the nurse this morning to give my blood sample, and she said, I think you should have looked at.
Oh, all right.
So they
enough.
both said, have it
Have a
looked
little
at.
look. 'Cause you're on aspirin, aren't you?
Yeah, that's why I'm
That
all
sore?
black and blue. Yes.
That bit sore there.
Yeah.
There's no bleeding from the nose or ears or
No,
anything?
no.
Good.
Ow. See that? I think the cheekbone.
Yeah.
Actually, it's probably bruised. You know, something like that.
It's all bruised around here.
Yeah.
Bless
No,
you.
doesn't look awful. And it will take ages to get better.
A few weeks.
I know it will.
You didn't lose consciousness when you fell.
Oh no, no.
Other side. Okay, good. I think it's just badly bruised.
Do you think so?
Yeah, I don't think you've broken anything.
No, that's what.
But because you're on aspirin, it does make you bruise more easily.
Yeah. Thought my beauty completely.
Oh, I know, you poor thing.
I think I had them bad enough to start with.
It will get better. We just got to be patient.
Eventually, yes. Anyway, I'm sorry to take up your
No,
time,
no,
but it
not at
wasn't
all.
my fault.
Better safe than sorry, though.
Well, I suppose so, yeah. Anyway, thank you very much.
That's all right. Take the lift, okay?
Okay.
Don't want you falling down the stairs now.
Bye-bye then.
Bye.
You look like you're dead, Mum.
Huh?
You look like you're dead.
I'm really tired. I'm really tired. I was in bed at 9 o'clock last night reading my book, and then Dad drank a full bottle of wine, which made me cross. He then fell asleep, missed the football, and it was my favourite that I'd had half a glass out of, so now there is none of my favourite. It's beautiful, beautiful Shiraz, and then I went down to get the glass and he drank it all, and that was half past 10. No, I told him to stay downstairs because I wasn't putting up with nonsense snoring, but he came to bed, so I went to bed in a mood.
What are they doing about your depression?
I'm 40 mg of citalopram at the minute.
Have you had any talking therapy?
Not yet.
Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what's in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked. I'm going to send you back to the diabetic clinic. Yeah. There's blood tests on the system. Will you book them for me, yeah? Here, yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results, yeah? If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me? Are you seeing anyone again about the citalopram?
Not that I know of.
What about hurting yourself?
No. I had a hypo fit at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Not feeling to eat, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health. What should we do next? What could we do next to help with that?
No.
Why not talk to someone?
Not really anything to talk about except for I'm just fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. Will you come back and see me after those blood tests? And will you stay on the citalopram until then?
If you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. Just phone up and say, can I make an appointment to Dr.
You just phone up and say, I'd like Dr. Gordon to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.
Can someone grab me some paper towels? Lady's collapsed in the street. But Sheila's with her. I think they're going to be okay. They're going to bring her in. Thank you. Thank you.
Hello. How are you today? I understand you had a panic attack in the workplace, is that right?
I was on my way to work.
Oh, okay.
I don't know what happened. I was fine in the morning. Dropped my kids off as per normal. I was driving. I started to feel my legs just started shaking. Hot and cold flushes. I could feel my just chest and everything just burning up. And then my hands just started to freeze. I couldn't change a gear, so I just pulled up. And then I called my manager, who then, while I was on the phone, I was sick, and then she just called the ambulance. But they've given this now. But
let's have a look. How are you feeling now?
Still on and off. Like, I'm getting hot flushes. I can feel like just steam coming out of me.
Yeah. So you think this is probably panic attack? Yeah.
I don't know. Maybe, I don't know.
Let's check. Give a few checks today. Check your temperature, listen to your chest, and look at your throat and see what's going on. And take it further from there. It's going to... No, you don't. It's not panic attack. It's your temperature, 38.2. So that's why you're shivering and feeling very cold and hot and sweaty.
Right.
It's a big I don't tend to use this, but I may need to because you're not opening your mouth big. Say big okay, that's good. Quick, listen to your chest. Thank you. Oh. The chest is all below clear, and the upper airways, there's some harsh breath sounds. You're coming down with a viral illness, and that's why you're feeling this way. The throat can become much more sore and dry, and you'll have mucus coating as hours pass by, and you feel a lot more unwell as well. So start taking Nurofen and paracetamol. Drink plenty of fluids and take good rest at home. There's nothing else sinister or serious going on as such. Yeah, and it's not panic attack or anxiety attack.
Okay.
Is that okay?
That's fine.
Yeah, you're feeling miserable and awful, but hopefully things will get better. Okay?
Thank you.
All the best now. Thank you.
Hello, Dr. Morris. Thanks for waiting. How can I help?
I've got two things
Uh-huh.
in my foot. I've used the wart cream as well.
Yeah, okay.
And
Yes.
this one is quite
Yeah.
painful
Yeah.
as well. And the same as
Yeah,
this one.
okay. The treatment for this is to buy something called duct tape. And you put it on, cut a little piece off, put it over it, leave it on, and usually within 2 to 3 weeks they go away. And it's twice as good as the stuff from the chemist or freezing or anything else.
And I can find it on the
So, okay, good question. So a hardware store, places like, B&Q, Wix, those sorts of places. You need a smear. You know
I
a
need
smear?
a smear?
Yeah, that's what it's saying, you need a smear.
It's been 5 years now.
Well, it's every 3 years you need it.
Is it?
Yeah. If you make your point on the way out, that'd be great. For that. Okay. Sorry. It's best to have one, though.
Thank you very much.
Okay. Bye-bye.
Hello, sorry to keep you waiting, my lovely. How can I help?
Good afternoon. Come and have a seat, sir. Hello. So, how are you today? How can I help you?
My little boy, he got a white spot in his pupil, left eye. He had been checked. We went to the Oxford Eye Hospital. He sent the fax over here and the post as well. So we want to discuss with you.
So it's on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think I see. It might, but not necessarily be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing. So I'm going to write a referral.
Oh, yeah,
so you should get something in the post.
Okay,
From the eye specialist, yeah.
Basically, looking at this, it's not just the cataract. Behind there is blood vessel formation and hence not a completely developed eye. And nothing sinister or cancerous, but he has advised against having a surgery. But I totally understand your concerns about whether there will be somebody out there else who could give a different opinion for a different, better prognosis and outcome. Initially, what he says is that by doing surgery, there is a risk of the back of the eye retina to detach, and that causes blindness.
I take it you're going to abuse me with your needles. Yes. Torture time. Okay, just try and relax that leg. Just let it flop as much as you can, okay? Prick now.
Are you here for another injection?
That's right, yes.
Yeah? You must feel like a pincushion, do you? All these injections.
You make yourself comfortable, because I'm about to shock you with the needle.
Can you take blood without needle, please?
Okay, sorry. Didn't even flinch.
It feels like nothing.
Exactly, that's how it should feel.
Oh dear. Here we come. Here we come. No John today? Have you got your new teeth?
Yes.
God, they're much better than the old ones.
I know they are.
You look great. Are you happy?
Yes.
I think they're great. Oh, that's very
Thank
kind
you.
of you. That's very kind of you. Let me get this chair out. I've known Peggy for probably 17 years. As soon as I started the practice, I got to meet her. She suffers badly from quite extreme osteoarthritis, which has affected most of her joints over the years, particularly her back. And when I started doing acupuncture as a treatment, then she seemed to be a perfect client for this type of treatment.
When you start sticking me, this calf
Yeah.
has really been hot and swollen.
Yeah?
And but I don't know whether I've overdone the gardening or what I've done.
How long for?
Well, it's just about cooling off now.
Okay. When do you mean by that? Do you mean for the last?
4 days.
Right.
And I haven't been able to do a lot with it.
You can't remember doing anything to it though.
No, definitely not.
No.
I've been doing a lot of gardening. I'm just wondering whether I...
You didn't feel a pull or a snap or anything like that? So I've been using acupuncture now for about 15 years. I attended a course and was a little sceptical after coming out, but I gradually introduced it to my surgeries, and over the years have found that 70 to 80% of people get some effect from the treatment that we give them. If you can cut down on medication, if you can reduce their pain levels, then I feel that it's a successful treatment. God, the hair's been done as well, hasn't it?
Yes. Very noticeable today, aren't you, David?
It's not routinely used under the NHS unless you go into a specialist pain clinic or physiotherapist normally. In fact, I think there's only 2 of us in Slough who offer acupuncture as a service, and we do it off our own bat. Okay, let's have a look. Okay, so nice and relaxed, just let everything flop.
See, that hurts. That really hurts.
So all over if I
Yes,
do that, yeah.
Yes.
Any specific point or not?
All
Just
that.
all of it?
All that.
All of it, all the way up and down?
Yes. Yes.
Okay, that's your muscle, isn't it? That's...
Is it? I want to talk about my toes. That one there now
Yeah,
That's coming over here.
the overriding one, yeah.
And this one is coming over.
Okay.
Like that. So do I have to phone up and speak to him, or do you have to?
I'd have to
me?
refer you.
Yeah.
I mean, the problem with that one is that you've still got a bunion of sorts here. Do you know what I mean?
I haven't had that done, have I?
Exactly. So it's in that direction. So this is a reasonably straight toe, but it's this one's popping underneath it.
Yeah.
Whereas that is just the most disastrous looking toe I've ever seen. Well, it takes a 90-degree turn, doesn't it?
Yeah, it
there.
does.
So so that's very different. So that would be to do something with that joint.
Yeah. I'm quite happy to have it done.
Whereas that one would be, I would be tempted not to do anything with that.
Okay.
Okay, because I think that would involve having to do this whole foot.
Yeah, and I don't want that done before I go away.
But that I think probably needs to. Is it causing pain?
Yes, and especially when I've got shoes, and I can't back to square one again. I can't get my proper shoes on.
Right, madame. What have we got these sticking out here? Here. 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 Here.
So I'll see about 5 to 6 weeks.
Yeah, I will. So we'll send that off to you and we'll get you back in again. Yeah. Look, let me help you. Well, what you're doing.
Thank you.
You haven't had a gin today, have you already?
No.
Okay.
Okay then, David. Have a lovely holiday.
I will.
Look after yourself over there, please.
I will.
If we don't operate, he might be left with a reduced vision.
So that's when he still can see.
He can still see. Right side is absolutely normal.
Yeah, I know.
People can function with one eye, but obviously, as a child, you need to want to make sure everything is perfect with your little one. Patients rarely ask for a second opinion. They usually trust the judgment of the doctors. In the John Ratcliffe Hospital, the consultant discussed with the parents the pros and cons of doing a surgery to restore the vision. The parents were told that by doing a surgery, there is a likelihood of blindness. Because of that guarded prognosis, the specialist told the parents that not doing an operation might help the little one. Hence, the parents came to see me for a second opinion. Yeah. If you do the operation on such a small eye now, there is always a complication of bleeding and the retinal detachment, and that causes complete blindness. So, whenever the surgeon is putting his scalpel or procedure anywhere, he weighs the options, benefits versus risks. Based on that, they give the advice. But there's no harm in getting a second opinion. Yeah. Parents are always anxious about and want to get the best outcomes for their children. As a parent myself, I feel the same. Getting a second opinion gives the patients extra element of reassurance. If I put myself in their shoes, I would think it's perfectly harmless to try doing that, because following the first opinion may not achieve the best outcomes for them. Hi, this is Dr. Nanda dictating a referral letter to consultant ophthalmologist in Great Ormond Street Hospital, London. The assessment and the first opinion is very detailed and clear. However, the parents are looking for further second opinion with a view for enhancing the overall outcome for the left eye for this little one, and hence this referral sincerely. Okay? So this will go, and the secretaries in the next 1 or 2 days will fax it across to the Great Ormond Street Hospital, and you should be getting a letter in the post within the next week or two. And I'll contact you on Friday after speaking to the Great Ormond Street Hospital as well. Is that okay?
Yeah, that's fine.
All the best for your little one, okay?
All right. Thanks a lot for your help.
Not a problem. Take care. Okay.
Yeah, thank you.
All the best.
How long have you suffered with psoriasis?
Quite a long time.
Okay.
But it's never actually been that bad before.
Where does it affect you normally?
It normally just affects me here, but now it's started showing up here.
Yeah.
Started showing up on my other arm.
So you've got it on your trunk, you've got it on your elbows, I can see. Have you got any sort of in your groin area, genital area?
No.
No? Any in your belly button?
No.
No? Okay. Your ears are okay?
Yeah.
Hair or scalp? Any problems with that?
No.
No? Okay, good. How do you normally manage this?
Well, I've been using creams in the past that, like, just ain't helping no more.
So there are some other things we could try which you've never had before. So one of them is something called Dovabet gel. Does that ring a bell?
No.
So I will give you something that will help to try and accelerate the clearance of this. But it is still important you use a regular moisturiser to soften the skin. Because it's what psoriasis is over-thickening of the skin. It's sort of almost, you could call it a defect. It's almost healing and thickening up too quickly. Usually if you do that once at night before you go to bed, that should be enough. But then you need to look into moisturising straight after doing that. Have you used Vaseline, that kind of consistency on your skin? An ointment?
A lot of Vaseline contains like nuts and stuff, and I'm allergic.
Okay.
So I don't want to be rubbing that on my skin and having an allergic reaction.
Vaseline doesn't contain nuts. It's a petroleum jelly. Have you used it before and had a reaction? It's basically an oil-based product, as opposed to...
There's like lots of different Vaselines. Like,
okay, so what I'll do, I will give you two things that I think will be best for you to try. If it works, then it's great. All right? And then I'll need to see you back to see if you're agreeing with it in terms of it's suiting you or it's making a difference. All right. Shall we do that?
Yeah.
Okay, see you soon.
Hello, darling. At 8:40 with the nurse. Right. Blood test or...? Blood test.
Hi, June. It's not. It's not a permanent move. It's just for this morning. So is it better for you being this close?
Well, for me it will be, but I mean, I'm just one.
All right.
I'm staying here.
Okay.
This is the appointment you told me not to cancel.
Good.
I am slightly worried about my theophylline level, having been told it's gone over 20. And my shakes are getting pretty every day.
June's main problem is chronic obstructive pulmonary disease, COPD, and the problem it's given her over the years has been progressive shortness of breath to the extent that this now is limiting her life. June is on quite a lot of medication. Theophylline has an anti-inflammatory effect to open up your airways, help you breathe a bit better, and also an effect to relax the muscles that we've got in the bigger airways in the chest and in the bronchioles. The problem with this is that if you give someone too much of it, you get too much of the effects. So your blood pressure goes up too much, your heart beats too fast, and you start to feel really quite unwell. Do you think the shakes are caused by the theophylline level being high?
Well, I take my tablets at 8 o'clock. The shakes start. It's like a caffeine rush, you know, where you're shaking inside.
Yeah.
And I've noticed recently, which is unusual, that after I take the theophylline at 8 o'clock at night, for about an hour I get slight shakes again.
How's the breathing been?
It's not as good as it was. I mean, at this time, with this steroid course, it's gotten a lot better. I don't know if it's just me, but I think it's beginning to creep into getting worse again.
What would you like to do about the theophylline level?
I'm in your hands on that one. I know it's a dangerous drug.
It comes down to the fact you are having side effects. Would you like to...
I'm capable of putting up with these side effects until I finish my steroids. See how we go on that one.
Right. So that brings on the issue about tapering off the steroids. We often use steroids for conditions in which we want to damp down a patient's inflammatory response, such as eczema or asthma or chronic obstructive pulmonary disease. Steroids, really useful drugs when used properly in the right dose We do worry about patients who have higher doses for longer periods of time because that's when you then start to have the side effects from them. So what do you want to do about that this time?
I really don't know. I haven't got a clue. I cannot cope with not being able to breathe, to look after myself.
I can only imagine how bad that must be.
Because what I find at the moment with the steroids, it gives me the get up and go before it affects my breathing getting better. As my breathing, shortness of breath gets worse, my get up and go disappears out the bloody window. The fact that I can cope with it goes out the window. It's a bit of a vicious circle.
Are you still having pain now?
No, it's eased off now.
It's
I
eased
say
off
that's
now.
why that pain was. I've not had it for about maybe 4 or 5 years. That sort of pain.
Really? So it's more severe than usual?
Normally it just goes, and I take my spray and it's gone.
What time roughly did it happen then?
I would say about 5 to 3.
5 to 3, okay, fairly recently. Yeah, okay.
I phoned the hospital.
And prior to that, you said you don't normally get pain this severe.
No.
How often does your angina pain normally affect you, though? Is it something that do you normally have to use your spray most weeks?
Yes, normally I have to use my spray. I go through quite a bit. Because I'm waiting to see the heart specialist.
Okay, fine. Apart from your inhaler and your usual medications, have you taken anything else today?
No, the only other new medication I have been taking is I was on citalopram, 4 milligrams.
And this pain, when you had it, did it move up to your neck or down your arm, or did it?
No, my arm went stiff. I know that. It
went stiff.
It happens quite often that way. That's why I took my pressure.
Okay.
Straight away.
So listen, what I'd like to do is do your blood pressure.
Right.
Have a listen to your heart.
Yes.
But I think what we also ought to do is get an ECG done. Yeah, you know what they are?
Yes,
the
I've had it,
stickers, yeah. So one of my colleagues down the corridor will do that in a second. Let's examine you first, okay?
I really thought I was going to black out. That's how bad it got.
Really?
A double vision. That's not bad for me.
I mean, that's good.
Yeah.
But I'm still a bit worried.
Yeah, I know that.
Okay.
I'm
Especially
very
because you know in yourself what is a normal angina pain, and for you this was severe, wasn't it?
This is severe.
And it sounds like it's been happening fairly often recently as well. I think today we need to do a blood test in hospital.
In hospital?
Yeah. So there is a blood test that we can sometimes do called a troponin, because sometimes you can get things can become unstable, and I really don't want you to have a more major episode than this weekend. Okay. So let's get an ECG done, and then we can have a chat about giving the hospital a call and getting you seen there today.
Okay.
Yeah?
Yes, sir.
Okay. So if you just stay here for a second, I'll just confirm which room's free to have it done. All right?
A couple of days ago, I started getting chest pains all around here. And then it started happening again today at work, and then I started getting pain down my arm.
Lovely, let's have a listen to the heart.
I saw you were admitted to A&E because of your heart racing. Is that right? Yes.
I think I can see a surgical scar over here.
An aneurysm.
Okay.
Are you having any chest pains now?
No, I'm not having chest pains. The only feeling that I have is this of missing of heartbeats and then a discomfort feeling, that's all.
Yeah.
Okay. Thank you.
Thank you.
All right, let's have a look at this. So, looking at your ECG, I think we still need you to be seen in hospital today, okay? So what I'm going to do is call Wexham Park, let them know your story and what's happened today. Okay. Hi, it's one of the local GP registrars in Farnham Road Surgery in Slough. Hi, I've got a gentleman with me who had a particularly severe episode of angina this afternoon. He is known to have ischemic heart disease, but this was a particularly severe episode for him and more prolonged than usual. So I think really he probably needs to come in and have a troponin and a repeat ECG. Okay. Thank you. Bye. I'm going to give you a letter to take with you as well.
Thank you. Okay.
Okay?
Thank you for all your
I wish you all the best.
Thank you very much.
All right?
For all your help.
No problem. Take care.
If you wanted an ambulance for cardiac arrest, which this is, here from the surgery, what's the number you're going to dial? You need 9 for an outside line, then it's 999. In the heat of the moment, people forget things. Different places may need 9 for an outside line, some places don't. Let's do compression then. One hand, centre of the chest, other hand on top. Get yourself comfortable. Go for it.
It's a bit of a vicious circle.
And is your breathing okay at the moment on the floor?
Yes, it's okay at the moment, and I'm coping. And then you keep finding things.
Yes.
It's not helping.
Not helping, yes. Maybe we should just stop looking.
I think you should. I keep telling you this.
Yeah. Patient's always right. We should listen to you, yeah.
I've got to last until my Charlie gets through medical school and graduates.
Okay, when's that going to be?
And at least one of my grandchildren gets married.
So what are we talking about? 10 years?
Yeah.
Okay. 10 good years, not 10 years of being looked after, but yeah.
No nursing homes whatsoever.
Mm-hmm.
I'd rather die than go
Okay.
there. So, yeah, quality of life.
Right, okay. So the plan then is, for the moment, let's keep on the same dose of theophylline and just see how you are with the side effects, and we'll repeat the blood test and make sure it's not creeping up. Do you want to come back next week and see how you are and discuss it again?
I think, to be honest, that's too soon.
Okay, 2 weeks.
Yeah.
Okay. Is there any chance you can actually read my doctor's writing there?
What the hell did they say about you at school?
Yeah, but that is my absolute best.
God almighty. Do they teach you to write badly?
There's 3 reasons why doctors write badly. Number 1, we rush. Number 2, we can't spell the medical words we're writing. And number 3, if you can't read what we've written, we can always say it's something else we wrote. Yeah, that's why it's all typed now, so you can't deny what we've written. And it corrects the spelling for us. So.
Right. Okey-dokey.
Okay, nice to see you. See you 2 weeks' time. I hope things settle down for you.
And then I've got to have to the right tone.
Okay.
Okay.
Peanuts. Okay, take care. Bye-bye.
Bye.
Hi, you're all right. Is it right to put this down?
Yeah, completely. That's fine. No, see.
Just basically, I just booked this appointment because I had it's called medical yesterday at work.
Okay.
And come out on my hearing test was pretty bad, and they said maybe we should come and advise with a GP. I thought come and get it out of the way.
Okay.
It looked scary. Basically, I just looked at this in category 3, and I was just like, well, that must be bad.
Okay.
And obviously, I have a few people at home, your hearing's not so good. They're always telling me
Yeah.
maybe I should do something about it, kind of thing.
Okay, so how long have you noticed that it's not been so great?
I ain't really noticed.
Okay.
It's everyone else. That
So
really
you don't have a
notices.
problem?
I don't really have a problem.
Okay.
It's just that sometimes I do struggle to hear certain distances and stuff like that, but I don't really. It ain't really bothered me up until the point of having this check, really.
And have you had any problems with your ears earlier on in life?
No, but my family have.
Hearing loss can be hereditary or it can be acquired. That's why it's important to ask about a family history, as families have many things in common, such as genes, their environment and their lifestyle.
My brother, he's had his grommets done, and my dad's got bad hearing. My sister's got a hearing aid as well.
Okay.
So yeah.
Fine. Okay, so I'm going to have to take a look inside your ears.
Yeah.
So what job do you do?
I'm a binman.
Okay. You are at higher risk of developing hearing loss if you work with noisy equipment. This is known as noise-induced hearing loss and occurs when there's damage to the sensitive hairs which lie within the ears. Just have a look in one, sorry. There's definitely no wax in there. Sometimes that can cause a problem.
That's what I originally thought the problem was.
Yeah, and I can see down to the eardrum.
Right.
And they both look okay. So don't know what's going on. So what I'll have to do is I'll have to refer you to the ENT specialist for them to investigate this further and see what's causing it. Okay.
Yeah, that's
All
fine.
right.
Will I get a letter or?
You'll hear from them directly. Okay. So
Okay.
anything between 6 to 12 weeks.
Yeah, I appreciate that. Thank you very much.
Okay.
Happy everything, yeah?
Yeah, that's fine. Take care.
Lovely.
Bye-bye.
Cheers.
Bye. Bye. See you later.
Thank you very much, doctor.
Bye-bye.
Okay, bye-bye.
All right, thanks.
See you, mate. You take care.
No problem.
Bye-bye.
Hello, Hawford Health Centre. How can I help you?
I press on there and that's sore. Yeah, that's very sore. Okay. Yeah.
Is it all right if I have a look at your chest?
You're so good.
No.
It's fed up with just being in pain all the time. It's just getting to the point where it's just... I'm so sorry.
That's all right. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime.
She reckons it's close to dementia. Still there on the end, red. I tried Germany. Jesus, what? Not a good idea.
Good morning, Hawford Health Centre. Sally speaking.
Morning.
Morning.
Come on in. How are you doing?
Arm. I don't know what's going on. It's been like it since the beginning of March. I thought
Okay.
maybe I'd sort of muscle thing or anything, but I can only sort of move it so far.
We can certainly have a look at that.
Right, okay.
Okay.
Okay, going up is fine. The side, and it goes that far.
And
then
whereabouts exactly is it painful?
it's
Just
like-
in the main...
Yeah, it's like, can't really pinpoint it, to
Is
be
it in
honest
the
with you.
elbow? Is it sore in here?
No,
And it's not sore when you move your forearm, it's sore when you move the top bit?
no.
That's okay?
Yeah.
Pull me in.
So I can feel something there.
Okay, and does it hurt as you go up the back, like doing your bra strap and stuff?
Yeah.
If you push me up here, does that hurt?
That does.
Okay. So that's the thing, that's the movement that brings it on.
is, yeah.
Just relax now. If I move it, is it less bad than when you move it?
Yeah, it's less bad.
It's less bad?
It's less bad.
Okay. It's good. So that helps me to figure out what's going on.
Oh, good.
So I think what you've done is injured one of the muscles around the shoulder that comes down into the back here. And it's called your infraspinatus muscle. And the reason I can tell that is because there's one movement that brings it on particularly, and that's pushing up against me here. And that is the muscle that's used to do that action and to move your arm around. The other thing that is making me sure that it's that is that when I move it, you're not having to use any of the muscles, obviously.
No.
And so, but it shows that there's nothing in the shoulder joint that's causing the problem. I think probably that this will just settle down with
okay.
some time.
Yeah.
And I think that probably we're going to get away without needing to do any physio if it's not causing you too many problems. I would suggest that you try some ibuprofen 3 times a day, maybe up to a month, would help to settle that down. And then I'll see you again. And if it's still bad at that point, we'll get you some physio for it.
Right, okay.
Does that sound like a reasonable plan?
Sounds good.
So yeah, try that plan and just keep gently exercising. One of the things that you can do for your own physio is to put your arm out here and write the alphabet. So,
really?
okay, so you start off small, A, B, and if you just do small letters first,
Okay.
C, D, and then later on in the week, do it a bit bigger, A, and then by, a couple of weeks' time, you can do really big letters.
Okay.
And then if you do the alphabet twice a day, morning and night, but just getting bigger and bigger letters, by the end you'll be doing huge ones.
Right, okay.
And that's quite a good way of just getting some of the physio done for your shoulder.
Right,
so
I will
do your
do
own
that.
exercises
I will
with the ibuprofen.
Do my own,
And then
yes.
we'll see you in a month's time if it's
Right,
not settling
okay.
down.
Good.
So, hi, and what's your name?
Susie.
Susie. Hi, Susie. How can I help?
Past few days, she seems has like sort of flash hot and then red cheek, and she has sort of like a cold sore in the mouth.
So this started how many days ago?
It's It's about 3 days.
Yeah? Has she been eating and drinking normally?
She's drinking, but she's not really
eating. She's not eating much. So, Catherine, how are you feeling?
When I just washed my face, it's too hard. It just hurts.
What does it hurt, lovely?
The little...
Hurts the little thing on your lip, OK. Outside of this being sore, is there anything else, owie, or hurting at all? Anything else sore?
My throat.
Your throat's a bit sore. Let's have a little look at you, if I can, darling, and we'll have a little look and see. I'll just put little gloves on, not because of you, because of my hands. OK, lovely, let me have a little look. Open wide like that for me, and give me a really big ah. Tongue right down for me, darling. I'm going to have to just tickle up the back there, darling. Sorry, love. Her tonsils look pussy again. I'm going to just lie... Can I lie you down, darling? Because I'm just going to make sure that I've got some swabs, because I'm going to take 2 swabs. One viral swab for the little ulcer, because that looks virally, but her tonsils look really white. You know, like they've got pus on them. What I'm going to need to do then is I'm going to have a little look at the back of that throat and then open wide. Right, it's a bit bright on that, so that's it. Perfect. So you close your eyes for me. Catherine, you're being ever such a very grown-up girl here. That's it. And open wide, wide, wide for me. Give me an R. Say R for me, love. Say R, R, R. Sorry, darling. What I'm going to do is I'm going to just now take a little tickle at the back, so it won't be like my finger. So if we just do the same again, it's just like a little cotton bud. So if you just open wide for me, darling, you're being ever such a brave girl.
Yeah.
Right, that's all done. Sorry, darling. I'm so sorry, Poppet. It's really mean. I'm so sorry. You're ever such a brave bunny. That's it. Good girl. I think she's got a bacterial tonsillitis again. And her breath is smelly, isn't it? I think you're a very brave girl. We'll send those off. So I think the throat is the problem. Yeah. And I think the ulcer could be related to it, but not caused by it, in a way. OK, we're going to give you some medicine, all right? And it's really important to take the full course. It's tedious because it's 4 times a day and for 10 days, OK? So I would make an appointment to bring her back to see Jane Gosh in about a week to 10 days. I will send both those swabs off, though, OK? So definitely get that tonight with the chemist. Yes. And lots to drink, OK, lovely? Make sure you're drinking lots of water like you're being a really good girl. You are very brave. I hope you just feel better soon.
Thank you very much.
Thank you, Susie. Thank you. Thank you. Bye, Annie. Bye.
Hey, did you come in? You all right?
No, not really.
What do we need to discuss?
It's my memory.
OK.
I had a row like with the missus last night over some stupid thing. And 20 minutes later, I didn't know what the row was about. And she asked me to put something by. I put it by. Then she asked me then a couple of hours later, that thing I gave her, where did you put it? I can't remember where I put it. It's things like that.
Is this something that's come on fairly recently, do you think? Or
no,
has it been going on for a while?
I've been going, for a while, like. I mean, I told her...
I think I've had a previous letter from the hospital where someone said they were a little bit concerned about your memory.
I told a specialist, and as you know, I've just seen her. And she said... your memory loss and what's called is probably due to depression, whereas you worry about your mother's death, you worry about your memory, you know. Well, I do get depressed.
So I think there was some concern about your memory before your mother's death, wasn't there? Actually?
Yeah.
Have we done a memory test with you at all?
What was that?
Just a test to try and assess actually how bad your memory is. Have we done a check at any stage?
No, I haven't. I can't remember it.
Can't remember one. I was about to say that, but you said it for me. OK, should we do that today?
Yeah, that's fine.
OK, and then we'll chat about where we go next. So I'm going to give you a name and an address to remember. OK?
Right.
The
Not
name,
too long, though.
Not too long. John Brown, and he lives in 42 East Street, Bedminster.
42 East Street, Bedminster.
OK, give me the whole name.
John Brown.
Yeah.
42 East Street, Bedminster.
Super. OK, I'm going to ask you that again in a minute, all right?
Right.
Romaniac, please. Okay, all right, you've been in the wars?
Yeah.
All right.
Good pronunciation.
Oh, was it? Okay,
Yeah,
oh good,
very good.
all right, good. That's good. Right, so you were in yesterday.
Yeah, I was in yesterday.
With toe problem.
Yeah.
And the doctor suggested you go and get it x-rayed. Have you had it x-rayed?
I went and they were really busy, and the bloke looked at me and had a look at it quick, and he said, "Oh, I'll just go and have a look at the x-ray you had 2 months ago." And he said, "Yeah, I can't see anything. You're gonna have to go back to your doctors."
Okay, let me have a little look then, just to try and see what's going on. It was 2 months ago.
Yeah.
You were playing American football, fell over, landed on your big toe. But you had an x-ray at the time, and you were told, OK, still unable to run or put weight through toe. Is a PE teacher, so affecting work, obviously. Dr. McLaren examined you yesterday. He thought it all looked normal, and he suggested re-x-ray to confirm no missed fracture. OK. Let's have a look.
Yeah.
OK, all right, which foot are we talking about? Your right
This
foot?
one, yeah.
OK, all right then. OK, if you want to hop up there and have a look. So this is now, we've just agreed, it is 6 weeks, yeah? That's just important because a soft tissue injury, my pat line is 4 to 6 weeks.
Yeah,
Now, you're not quite at that yet.
Okay.
OK? Now, I don't know if you've been resting it.
I have, yeah.
OK, so whereabouts now is the pain?
If I press in here, it's like excruciating, right underneath there.
OK. I'm not pressing hard enough, or is that...
It's like where you had it there, like underneath.
Just under here, yeah. So it's a little bit warm, it's a little bit swollen. OK. So how long did you take anti-inflammatories for?
Probably the first couple of days.
OK. Right, well, I agree with you, it's a little bit warm, and it's a little bit red, and it's obviously still sore. So you get your things back on, and let's have a think about what we're going to do. OK. OK. Right, so you put your...
It's just one of these things because sports is my life, and like I'm sitting at home feeling like I'm getting fat, I'm getting like depressed over it, and I can't like.
Okay. First thing, is that 4 to 6 weeks you're not quite at that yet. Okay. So what I would do now is take anti-inflammatories and then book in to see Dr. McLaren in a routine appointment for maybe 10 days, 2 weeks time.
Okay.
See if it's improving.
Okay.
And then we can take it from there. Okay.
No problem.
Is that all right?
Yeah.
Sorry. I'm sure you get through.
All right.
I'm sure you'll get there.
Yeah.
Okay? Don't run before you can walk, literally.
Yeah.
Okay?
Thank you so much.
Okay, all right then. I hope it settles down soon.
Yeah,
all right,
thank you.
bye-bye.
Bye-bye.
What was that name and address I asked you to remember?
Brown.
What's his first name?
Brown. E Street. I can't remember.
I can't remember his first name. Do you remember what his address in East Street was?
No.
No? OK. And do you know where East Street is?
That's Bedminster, isn't it?
Bedminster, that's right. Is that good? Yeah, OK. Now, without looking at the watch or clock or anything, can you tell me what the date is today?
No. 10th.
10th of what?
Of June.
OK. And the year?
2017.
OK. OK. All right. Now, a little drawing exercise here now. This is a circle. OK.
Yeah.
I'd like you to imagine that that is a clock face. Can you put the numbers around the clock face for me? OK. Now, if the time was 10 to 2, where would the hands be? Could you draw the hands in on your clock?
10 to 2. 10 to 2.
Have you? OK. That's the end of the memory test. There were some gaps in your memory. I mean, obviously you struggled a bit with the fellow's name at the end, John Brown.
John, that's it.
Yeah.
Yeah.
And you did struggle a bit with the clock, actually. But
12?
Well, no, but not putting the numbers around the dial. I don't know if you...
Oh, right round, you mean?
Yeah.
That's why you do it like that.
Yeah. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime and see how she perceives it.
What she reckons is I'm close to dementia. I just go into dementia. Okay. It's stupid, isn't it?
Okay. But I'll have a chat with her sometime. What we normally do if people have got problems with their memory is there's a set of blood tests that we do, which just occasionally help us to know what's going on. We normally get a scan done of the head as well, CT scan of the head. I don't know if you've had a CT scan for your epilepsy at all, have you?
No. I've got so many tests I can't remember.
And it will also be useful from an epilepsy point of view as well. So we get that scan done, we get the blood test done.
Yeah, I've had a few fits.
Yeah. And it'll be useful to meet with your wife next time, actually. Book a double appointment and come with her. All right. You'll get an appointment through the post for a scan.
Thank you.
OK. And when you've had the scan, give it about 10 days and then book an appointment and come with Liz for a double appointment.
Right.
OK?
Yeah, thank you, Doctor.
Jolly good. Okay. Bye-bye. Now, I'm Dr. Jewel. Hello. And this is Mummy, isn't it?
Yeah.
Usually I ask that, but we know that already. What can we do for you?
So I brought her in about 4 weeks ago because she had a really nasty cough, but she was fine in herself. She was running around, so I didn't think it was that big of a deal. But it turned out she had a chest infection. So she had some antibiotics for 5 days, and the cough went away for about 4 days, but then she must have got another virus. So she's been coughing pretty much on and off since then, but I've noticed the last 2 days she's been coughing up some pretty disgusting things again, haven't you? Yeah.
What's she been like in herself?
She's generally quite an ill child, but she does tend to just crack on. So, yeah, she's been running around, she's been going to nursery. We've been on holiday, haven't we, last week?
Where did you go? Do you remember?
Yeah.
Do you remember? Was it
Tenby.
Tenby.
Tenby? Do you know, I've never been to Tenby. Everybody says it's really lovely. OK, let's have a look.
Let the doctor listen to your chest like
Emily,
last time.
is it all right if I have a look at your chest?
You were so good last time, weren't you? You were
Why,
super
sweetie?
Good.
What's the matter?
Oh, she doesn't go.
Sophia, what about if Sophia has hers listened to?
Well, let's do this. We're going to listen to Mummy's chest. Then we're going to listen to Sophia's chest. And then we're going to listen to your chest. Excellent. Very good, good. Can I have a listen at the back?
Can you see?
There we go.
I can see a bed.
Can see a bed? Do you think the doctor has a lie down?
I have been known to have a doze in the afternoon. To have to make sure somebody wakes me up in time for surgery.
Brilliant.
One last thing, just to feel under your chin. So just...
What do you think's under your chin? Do you think there's...
No, sweetie. Come here.
Sit on my lap.
Sit on Mummy's lap.
You're being so good. Do you remember Mum
Emily.
said if you're super, super good, you might get to have a token when we get home? Yeah? How many tokens have you got at the moment?
I want you to give me your hand. Thank you. Do you want to put your hand on top of that? Do you ever play this game? Now listen, all I want to do is to feel here, sweetie. There, that's lovely. That was all. I'm finished now.
Good girl.
She's fine. I'm not going to give her any antibiotics.
Okay.
Her chest sounds clear. She's not struggling to breathe.
Brilliant.
At all.
Okay.
She looks well.
Yeah.
I think it's interesting that you're worried about her.
Yeah, I think it's because I missed it last time.
Ah, yes. So you feel a bit, you know,
yeah, bad, and then.
So that's one. So that's a perfectly sensible explanation. That is. So you know, until they're about 12, this is what happens.
Yeah, and this is why I do tend to just leave it. But I think because it got bad last time, I felt a bit.
But while everything else is okay, while she's not struggling to breathe, and she's normal temperature, no, don't worry about it.
Okay, fantastic. There you go. That wasn't too bad, was it? You're going to say thank you?
Thank you.
Oh, good girl.
Emily, it was a pleasure. You were a really, really good patient. I don't know what
So
your mum view was
good.
being so good and helpful. And Sophia
has done a fantastic picture.
Time to go home.
Yeah, let's go home. Thank you very much.
Pleasure. Bye-bye.
Yeah, you still got it. Say bye. Say bye-bye. Can I help?
Stand away because I'll trip all over you.
Where did that lot come from? They said it was
It's
going to
not
be heavy.
cold, though.
No, but they
That's the
said if
thing.
it's going to be heavy, it'll just
Yeah, absolutely.
chuck
We'll
it
see how
down.
waterproof it is. Thank you. Can I have a peek of my prescriptions, please?
Yeah.
Have a seat.
I'll sit over there.
Yeah, I'll be all right.
Right, what can I do for you?
Stressed out from work.
Right.
I did ring them this morning, tell them what the problems were, which was a long list I give them. I said I just want time out. So I've also been snappy with my wife as well, coming home. Unbearable. And just shaky as well. Okay. You're not sleeping either, are you? No, I was up at 4 o'clock this morning, which was unusual.
So how long's this been for?
A couple of weeks you've been Yeah, 2 weeks, I think.
Right, okay. And what's brought it on, do you think?
Stress at work, plus when I'm going home, I got to care for my wife as well. Just getting too much. He's near to tears, because you can see that, aren't you? Hey, yeah.
Okay. And it's okay if you want to cry? Yeah? Sometimes it
Just
does
let
us
it
good. When you say you've got to care for your wife if you've got medical problems?
Yeah, I've got very bad arthritis in
Right.
my legs, and there's things at home that he has to do for me, and at the moment, you know, stupid things like I can't get to the shop, so we need a loaf of bread. He'll come in and say, oh, we need bread. And the balloon goes up. Okay. At the moment, because he's snapping at me, we haven't got that relationship. We've got a very good relationship that is like, well, what have I done?
Okay.
I'm stuck at home 24/7, you know, and it's like, isn't it? And I mean, we've had our holidays, not as though you need... I mean, we're only, what, just over a month ago we were in Portugal, so it's not as though we It's not like him. Normally, if I say, could you do this for me, he does it, and it makes me feel guilty, because he's stressed.
Yeah.
And it's like...
Okay, okay.
Running a little bit behind today, hopefully not too long.
God, it's been non-stop today.
Come on, what are they doing?
So I'm running late. It's Dr. Ahmed, OK? About 20 minutes.
Give me 1 second and I might be able to do something for you. Be with you just 1 sec.
Oh. Hi, can I help?
So you're under a lot of pressure, at home. And what's the stress at work?
Well, explain to the doctor what you do. I'm a driver carer for adults with learning difficulties. I enjoy the job. It's not a problem, but they've been putting me under a lot of pressure, changing what I'm meant to be doing, not informing me, and things like that.
Sometimes things just hit the limit, don't they? So what do you think will help at the moment?
Time out, time away, and just potter about or go out or...
Yeah. Why don't we give you a couple of weeks off work and come back and see me in 2 weeks to see how things are having had time out? Yeah? Okay. So there's a sick note for 2 weeks. We can always extend it, so don't think you've got to go back in 2 weeks, OK? Take this to reception to book a follow-up appointment with me, so then I can follow you up in a couple of weeks, all right? OK, things will get better.
Right, OK, thank you.
No problem.
That's it. Thank you.
Have a seat.
Good afternoon.
Good afternoon. I'm Dr. Jewell.
Right, I think I've got an ear infection because I can't hear properly this right ear.
You can't hear properly out of it?
No, everything's...
It's not because it's hurting?
It's like being underwater, as such.
You had it before?
No.
OK. How long has that been going on for?
Since first thing Monday morning.
Let's have a look at this here first. Yep, that looks fine. That one looks all right as well, which is a bit of a disappointment.
You've got a little bit of wax in there, but nothing that's obscuring it. Now, hold on. Somewhere in here, we have a very old-fashioned piece of medical equipment. Have you ever seen these things before?
Yeah.
OK, can you hear that?
Yes.
If I put it there, can you hear it?
Very faintly.
Is it louder there or there?
There.
Good. Louder there?
Yes.
Or there?
Louder there.
OK. Can you hear it on one side or the other?
Hear it more on the left.
OK. We're going to do a very crude test. I'm enjoying myself. Now, what I want you to do is to turn and face me. And we're going to do a crude hearing test.
OK.
I call out numbers. You call them back to me so I know you've heard them properly.
OK.
Put your left finger in your left ear. 67.
67?
32.
32.
Your hearing's all right. Don't know what makes it.
It's very, very quiet.
Yeah, OK. Other ear, but I think there's no problem about this. 86.
86.
23.
23.
And that was easier to hear?
Yeah.
Yeah.
A lot easier.
Yeah. Now, that's a very crude test, but it's good enough to satisfy me that we don't need to worry about this, but we can afford just to wait and see what happens. You maybe have you had a cold or anything that would explain it?
No.
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 Okay. I think it might be sensible just to wait and see what happens.
OK.
Give it a few weeks, and then if it's still bad, try out there.
OK.
All right.
All right. Thank you very much.
Pleasure.
Thank you.
Bye-bye.
I've grown up with that. My dad's like that. He makes tea exactly like David. And, you know, if you go somewhere, he needs it in a teapot, needs the milk separately and hot water separately. So in cafe, you know, in Costa Cafe or whatever, it can be quite proper.
How are you getting on?
Pain.
Pain?
A lot of pain. It's just getting stupid.
And is this the pain that we were talking about before with your tummy, or is it different? No, same
Just
pain.
getting more and more intense.
And this has been going on for a long time, hasn't it? Have you heard anything more about the referral that we made to the gynaecologist?
Yeah, I've got a letter through for a choosing book thing.
Oh, good. Because actually that's part of what we need to do, isn't it? From my point of view, I'm wondering about if we can just keep you going until you get to see them. Is that with some painkillers? And then we'll see what they've got to say about what they can do.
It's fed up with just being in pain all the time.
Is there anything else going on that's making things worse?
It's just getting to the point where it's just, like, you just feel like you can't be bothered to do it anymore. You know, I don't get a lot of sleep as this anyway with my second youngest, because he's insomniac among other things. But it's just, with, like, the pain on top of it, it just makes, you just get up in the morning and you're just like, I'm so sorry.
That's all right, here's a tissue, look. Why do you think it suddenly got on top of you? Has anything else been happening?
No, it's just getting, like, the pain's just getting more intense, more frequent. And
What are you using for the pain at the moment?
I take cocodamol, and then I take 2 tramadol before I go to bed.
That's right, I remember you saying that before.
Amitriptyline.
Yeah. Are you taking any anti-inflammatories?
I can't take amitriptyline.
Why is that? Why?
It makes me bleed even more and gives me
Does
even
it?
worse
So it's
tummy.
actually that settles it, sets it off.
Yeah.
And what about the amitriptyline? What dose are you on of that?
Well, 2 some nights, but I have been putting up to 3, like you said.
Because that's a very reasonable thing to do. Has it made much difference? No. Because it makes that tricky, doesn't it? Because you're basically on the full dose of all the different painkillers that we've got, especially if you then can't take one particular class of them. In terms of medication, the other thing would be to try some more, you know, something stronger on top. But I think I remember you saying that if you tried other stronger opiates, then it just made you feel really sleepy in the day. Was that right?
If I stopped taking the tramadol, it was like I was like a heroin addict or something. Like I was proper like shivering, I felt all fluey and everything.
Maybe then the best thing is for me to write a letter to the gynaecologist asking for them to see you urgently and just pull it forward that way to make sure that it's going to be quick. Because the problem is I don't know, based on how long the referral date will be, whether it is going to be 2 weeks, in which case maybe we can just carry on waiting for it, or if it's 2 months, then obviously that's too far away, isn't it? Shall I drop them a quick line and just make sure that that's pulled forwards? And I'm going to see you in another week or two just to double check on how things are going, but mainly just to talk again about how you're coping with it all, because it's obviously really difficult for you, isn't it? Have you got any other support? Who else is at home helping you out?
It's just me and the kids.
That sometimes makes it really tough, doesn't it? And of course, there's no magic fix for those sorts of things.
Yeah.
Sometimes there are some charities that are available that will give you extra support. The Citizens Advice Bureau can give you advice about where to turn as well when they're looking for these sorts of things. So they may be worth an appointment. Do you know who I mean?
Yeah.
Have a chat with them about whether there's anything else about that, and I'll see you in a couple of weeks, and I'll get on and do that letter for you.
Thank you very much.
All right.
Thank you.
I'll see you soon.
Very good at manoeuvring.
Thank you. Lot of practice over the years.
Yeah. OK, coming in. And are you a carer or a relative?
Carer.
Yeah.
Carer.
OK. So you think you're having a bit of a flare-up of the MS? Yeah.
Yeah.
And what happens normally when you have a flare-up?
I don't know, it depends. I get different symptoms, but always one leg or both is affected anyway.
OK.
Sometimes my arms.
Yeah. So overnight and this morning, it's the right-hand side that just feels weaker.
Yeah.
Painful.
Really painful.
Right.
I'm actually waiting for HSCT treatment as well.
What's that?
That's stem cells and chemo.
Oh, right, OK.
So I'm waiting for a phone call. It could be about 4 weeks' time.
How much is that meant to work?
It's got a good chance of stopping progression.
Right, OK.
So if it stops progression, I'm happy enough with
Yeah,
that.
absolutely. That's
we go.
exciting then, isn't it?
It is. It might
So what does
be.
the actual treatment involve?
The first time I have chemotherapy, the first time for a day.
Yeah.
And then the second time I go up, I got to go into isolation for about 3 weeks.
Right.
I have 5 days of high-dose chemo.
Yeah.
The stem cells are taken out with me.
Yeah.
All the MS ones are taken out of that.
Right.
And then they're put back into
Beautifully described that. I bet the doctors told it like that to you. did they?
Yeah.
No, that's easy to understand like that, isn't it?
Yeah, that's putting in.
Yeah.
It's a really big thing because I've got secondary progressive, so I'm only ever going to get worse, but this will stop it dead in its tracks. And I won't have MS anymore. I just don't know if I'm still going to have the symptoms that I've got at the moment.
OK.
MS. It's an autoimmune condition that affects the brain and the spinal cord. This is where the body sort of attacks itself. In this instance, it attacks the surroundings of nerve tissue and affects the messages sent along those nerves. There are two main focuses of treatment with MS. One is to treat flare-ups and relapses. This is often with steroid therapy and individual treatments looking at specific symptoms. The other way of treating it is by using disease-modifying drugs to try and prevent relapses.
Is there anything to see on your arms at all?
No, I said, but I think they're quite
there.
bruised.
Yeah, what's that from?
I don't know.
OK. And squeeze my fingers for me. So there's less power there. Is there always less power there? No, so that's
This
less
is my
than
good size.
Is it? Right, OK. What about your leg? So pull this one in. That's it. That's quite good. And try this one. So pull it out and then try and pull it in. Yeah, it's less there, isn't it?
Yeah.
OK, so I think we need to just speak with the MS nurse, really. How quickly, you said you don't know when she'll get back to you?
No. Sometimes they get back to me within a day or so.
Yeah. Well, look, I'm here all day. You've rung up this morning. If you don't hear anything by 2:30, 3 o'clock, give us a ring here, OK?
Yeah.
And we'll reassess and see if I can try and speak to the consultant if we can't get hold of the nurse.
All right.
All right.
Okay.
So let's hope the nurse rings you back, but if she doesn't, give me a shout.
Yeah.
Is that all right?
Yeah, that's fine.
If I don't speak to you, good luck with the stem cell.
Thank you.
Anne-Marie Jeffries, please.
Hi.
Hello there.
Hi.
Right.
I'm okay, thank you.
Good. You have a seat there. All right, what can I do for you today?
It's been for about the last couple of months, but it's been getting worse. I keep getting really bad pain and soreness, starting from the armpit and going just around there.
Okay.
I keep a check on it to see if I can feel any lumps and bumps. I haven't been able to feel anything, but it's just really uncomfortable and painful.
Okay, so 2 months pain in your right armpit, coming round onto your right breast.
and then just coming round on the right breast.
All the time, or is it related to your period or anything?
It seems to be pretty consistent, like.
Okay. And you're well otherwise, are you?
Yeah.
Okay.
Yeah.
Nothing around the other side?
No.
Periods are okay?
Periods are normal.
Not pregnant or breastfeeding?
No, definitely not.
Definitely not. Does it feel like it's your muscles or your ribs, or does it feel like it's inside?
It doesn't feel muscular. It's really weird. It's just like, and I can't really put my arm down like that because it's just like.
So it's certain positions.
Yeah.
Okay. What about if you cough?
If I cough, it hurts quite a lot more.
Okay. Have you got a cough?
No, not at the moment.
No. All right. We need to have a little look. Okay. Is that okay?
Yeah.
I'll put the curtain over you. If you want to slip your top things off.
Yeah.
Can I pop round?
Yes.
Okay. All right. And you'll just get your arm up. Okay. Have you got the pain right now?
Yeah, it's like, so it's like from there, yeah, it's like, hurts there quite a bit.
Okay.
Yeah.
So I press on there and that's sore.
Yeah, that's very sore.
And then it comes round a bit further, does it, as
Yeah,
well?
ow. Yeah.
Sorry, okay. Have you got pain over here?
No.
No, not at all? Okay. Can I just check the breast area, is that
Yeah,
all
that's
right?
How are you on this lovely sunny morning?
Oh, raring to go.
Yeah.
So tired.
I know, it's weather.
Yeah.
Sleeping.
Would you like a tissue? Because it's quite hot, isn't it?
Thank you.
It's so hot. I think my face has melted.
I get sweat pads in the back.
Are you getting enough to drink? I mean, the weather is very hot at the moment.
So hot. I know. It's so nice outside.
I never wish for this heat. They're lying. I like the winter.
Do you?
Yeah. Snugging up on the sofa with cups of tea and hot chocolate. Fire, blanket, I love it.
Nice. That sounds quite nice. But...
And then in the summer, it's just like, I just need my space.
Yeah.
I was like, nah. Are you all right having your blood taken?
Yeah.
Yep.
I'll be fine.
Okay.
I think. Should be.
Okay, you sure?
No, yeah, I will be.
Yeah.
I give blood. I'll be fine.
All right, then. Which arm do we go for bloods?
I'm right-handed, so maybe I should do my left.
All right, yeah, that's fine. Whatever suits you. I just do what I'm told.
So is it checking everything? So it's just going to check for...
Yeah, you've got a bit of a full MOT going on here.
Good. That's what I need. I'm falling apart.
Oh, really?
Ooh. Yeah, I've got all sorts going on.
Oh, that's not good. Well, hopefully we can get you back up on your feet again.
I know. Hopefully we'll find something out. I know what will happen. It will come back and be like, oh, you're fine, you're healthy. Yeah.
You're like, what's wrong with me then?
Something's wrong with me. I know.
Don't go fainting on me now.
No, I won't. I won't. I'm not really squeamish.
I find all of this quite fascinating
Yeah,
now.
I think I'd quite like
I do.
sticking needles in people.
When I first started doing the training, I was a bit unsure, and I was thinking, I don't know.
Yeah.
Because you practice on this like kind of like plastic arm.
Oh yeah.
And it's got like veins in that, and then once you go kind of let loose on patients, you're a bit like. I can remember I was doing it with one of my colleagues, and my hand was like that. I was so nervous, but then after a while, it's
quite fun.
Yeah, you just get used to it. Okey-dokes. That's brilliant.
Nice.
That is you all done. So these will be back Monday, and then you can speak to the GP about the results.
I think I'm in like Thursday or something anyway, so I might as well just wait. Cool. Thank you.
No worries.
Ooh.
Have a nice day.
You too. When do you finish?
5:30.
Oh, not too bad. Thank you.
Take care. Bye-bye.
The breast tissue itself's not so sore. It is what we'd call musculoskeletal.
Okay.
That's fine. Okay, you put your things back on. Did you take up any new sort of fancy exercise or anything like that just before it started? You been doing anything weird? What's your job?
I clean, so my job's quite vigorous.
Yeah. Okay. Okay. The good news is I can't see anything.
That's
I'm worried
good.
about that. Okay. I think that is what we would call musculoskeletal, which means it's like the soft tissues or the ribs around there.
Okay,
It's not the
yeah.
breast that's the problem. Okay. What I would suggest you do is, rather than taking any tablets, you get yourself an ibuprofen gel, which you can go and buy, and it's cheaper to buy. If that's all right. Okay.
Yeah.
And just rub that on, and then
Okay.
just start doing some gentle. Do you do much exercise? Are you sort of...
I've started playing netball.
All right, and can you play netball? It's not uncomfortable to play netball?
It's a bit uncomfortable, but yeah, not.
Great. Use the gel.
Okay.
Continue with your netball.
Yeah.
That's fine.
Okay.
And wait and see what happens. So
Okay,
hopefully that
cool.
will just settle down.
Okay.
All right?
Okay.
If
Thank
it
you
doesn't,
very much.
I'd like to see you again.
Okay.
Okay?
Thank you
Is that
very
all
much.
right? Okay.
Thank you.
Hi.
Uh-huh.
Hi. How are you doing?
Tired. My eyes feel like peels in the snow.
Right. What do you mean by that?
They're tired.
Yeah.
They're sore and but they're just sore.
And you link it to tiredness, though?
Well, I do, yeah.
Yeah, and is that a feeling that you've had all your life when you get tired, that your eyes get like this? Or
Only
is this
since I started having the diabetes.
Right, OK.
Now, knackered.
So the tiredness is linked to having the diabetes. What about the eyes? Is that something is that a feeling that you've had before, or is that something...
Yeah, they just feel sore and tired.
Just not right?
No.
Is your vision OK?
Not all the time, no.
Not all the time?
Bit blurry.
When does it get blurry?
Basically when I lay down on the bed and watch television.
Yeah. And when you blink and try...
It clears it.
It does clear it. So it does go back to normal. Let's have a little look at your... eyes here. Have you been to the optician?
Not lately.
Just look up. Look down. Look left. No double vision. Look right.
Gritty.
Feels gritty, does it? Yeah.
Not now, but it does.
So I think what's happening is that the eyes are being feeling gritty, and probably I'm going to try some moisturising drops because that's the most likely cause of them feeling a little bit uncomfortable. I want you to go and see the optician as well and just get your eyes checked over. I can't see in the back of your eyes very well, and that needs to be looked at by the optician just to double check that that's OK. And I think a lot of this is down to the diabetes, and that's what we're working on to try and control as well.
Yeah, I know. I should murder that.
I'd like to see you in the next 1 to 2 weeks just to check up on the health. And if you could go to the optician in the meantime. And I've sent the drops over to the chemist.
One other thing, can I have some more ointment for my downstairs because it's not gone. I've been to the hospital twice. They said it's I don't know, some name, but not anything to worry about. It's still there on the end, red, and I wipe it every time I go to the toilet now.
I'll give you some more.
I tried Germany, Jesus, what? Not a good idea.
Try this one, ongoing.
I thought I'd have a go at Germany, I got enough here. And I wish I hadn't.
So if you take that to the front desk, the cream and the drops have gone to the chemist. All right?
Yeah.
See the optician too about your eyes.
I'm beginning to feel I'm a nuisance.
Well, it's not something that I'm feeling, so, you know.
Well, I'm glad about that, but I get peed off with... I told you I got this, I got that, but I have.
I know. Well, that's, you know, part of the challenge, isn't it, of getting a bit older?
Oh,
I know it's annoying.
That old chestnut. Yeah, unfortunately, you're right.
I'll see you soon.
Yes, hopefully. Cheers.
Bye.
in the Ridge Medical Practice. Megan speaking.
Well, I'm so glad you came today because any kind of pressure in the back of the eye can lead to permanent sight loss.
I have a lump here.
How long have you had it for?
I'd like to blame Brexit, but I've had it about 15 years.
All right.
That might be a separate problem.
Blimey, how many problems have we got?
Oh, you've only got 10 minutes. You know, use them wisely.
Hello. She loves her Auntie Debbie, don't you? Yes, she does.
I don't feel that on.
You need to be very clear on this, Mark.
Yeah.
If your breathing is off, that means I'm going to have to send you to hospital.
Hi, Miss Carver. Come in, how are you doing?
Yeah, not bad.
Come and take a seat, Jake. Nice to see you. Right, I'm Dr. Khan. How can I help?
I've got this bad cough. I've been coughing up sort of phlegm sort of thing for a while.
OK.
But I moved out of a house yesterday, so there's been things burning in the garden, there's been bleach all around, everything like that.
Right, OK.
And since last night, I've basically just been coughing up blood constantly.
Right,
so
OK, yeah.
111 have told me I have to come straight in.
I think 111 are right, OK. Right, so you said you've had the cough for a while.
It's been about a week and a half.
Yeah, yeah. And prior to yesterday or today with the blood, what was coming up with it?
It was just phlegm. I smoke, so that comes a lot.
Yeah.
But obviously blood's a different thing. So.
Yeah, of course. OK. You mentioned some slightly worrying things, which is things have been burning in the garden and there's been chemicals around as well.
Yeah.
Tell me about the blood that's been coming up. What's that been like?
It was like thick and gumpy. It's horrible, yeah. It's like you get a mixture of like the phlegm sort of thing in the blood.
Okay.
But yeah, it's not pretty.
Yeah. Bright red or dark?
It's quite bright, to be fair.
Yeah.
Yeah.
And is it mixed in with the phlegm or is it pure blood that's coming up?
A bit of both.
And it's every time you cough?
Yeah, pretty much, yeah.
Ariana, she's 7 months old now.
Yes.
Hello. Do you like standing up now? Right, come on then, what's the problem?
OK, so her eczema started to flare up again.
Did it settle?
It settled, but it was still sort of a little bit dry, so I've kept up with the creams.
Yeah.
Back of her neck and under her chin, that's never really cleared up.
Right.
And she's itching her eyes quite a lot.
At this age, they develop habits as well.
Yeah.
So if they start pulling their ears and they like it, or they're rubbing their eyes and they like it, they carry on doing it. We'll have a look at her anyway.
OK.
I'll do a temperature. Sorry, love, you do. Dad's blind.
Yeah, Dad's blind.
Sometimes we forget to tell people because we know you so well.
Yeah, yeah.
So her temperature's normal, so I need to listen to her chest.
Yes, that's fine.
You're not bothered, are you? You're not bothered. Gorgeous girl. I'm just pulling her tights down and I'm just opening her nappy.
Yeah.
There you go. So sit her back on your knee, Dad.
OK.
We'll have a listen to her chest.
It's non-stop talking now, but she's gone quiet today with you guys.
Are you shy today? That's fine. Right, let's have a look at this skin. If you lean it, lay her back, but keep her on you. That's great. So tell me what you're worried, where you're worried about.
It was more on her tummy, and I think there's a little bit left down there, unless it's gone not that bad today, actually.
This skin here is absolutely beautiful, and so you are doing a really, really good job. Look at her face. Are you going to do a bit of this now? A bit of kicking. If a baby has got baby eczema, it doesn't mean that she's going to have eczema forever, but it does mean that her skin's going to be more sensitive. So she'll have good days and bad days. So like you say, it's better today. Yeah, is that good? Hooray! Hooray! Yeah! The treatment is moisturise, moisturise, moisturise. Because if you get a dry skin and a bit of a sore area, that's when your germs get in and it flares up and it gets infected. Keep putting that moisturiser on 4 times a day. Use it instead of soap. Do all that. Her skin will stay like this. I'm absolutely delighted with it.
That's fine.
She's beautiful. She loves her Auntie Debbie.
She
Don't
does.
you? Yeah, she does.
Everyone's got nicknames for me, it's amazing.
Like what?
Beth and Lorraine call me Ebbers.
Ebbers.
Asad and Ruth call me Ebony. And My mum calls me Ebby, Ebs, idiot.
Idiot.
I love talking to you on a Monday. You always cheer me up.
Aww. Cheer everyone up.
If you get any phlegm now,
Yeah.
let me know, because I'd like a sample of it. Yeah,
Which one?
Which you choose. There you go. So your oxygen levels are good, 99%. Your pulse is nice as well. Let's have a think about things, because you've had this cough for a week and a half. Now you're coughing up blood. Your chest sounds reasonably clear when I'm having a listen to it. It's not obviously an infection when I'm having a listen there.
All right.
But that doesn't give us an idea of what is going on.
Okay.
One thing that makes you cough up blood, not that rare in Bradford, to be fair, but TB, tuberculosis.
Okay.
Sounds like a bit of an old disease, but we know that with an influx of people from different backgrounds in Bradford, it comes and goes in phases. There are other more worrying things. I don't think we need to worry about anything like lung cancer with you because of your age, but you do have a smoking history.
Okay.
And I'd like to send you for a chest x-ray to see what might be going on there.
Yeah.
I'm not convinced that this is just a simple chest infection and you're coughing forcefully and you're bringing up some blood.
Yeah.
It just sounds a bit iffy. And with the history of you having some chemical and fire exposure as well, I just want to have a closer look at some of the glands inside of your chest and the lungs as well.
Okay.
Do you think you'd be able to go for a chest x-ray this morning?
Yeah.
Yeah?
That's fine.
If you can go today, I should get the result back by about Thursday time. Why don't I phone you with the results and then we can go through it there. All right. Nice to see you, mate.
Nice
Cheers. See you later. Bye.
Hiya.
Hello.
What's your name?
Matt.
What is it that you want to speak to the doctor about today?
Recurring backache, and I've got pins and needles in my arms and my back and my legs.
Okay.
Hiya, come on in. Dr. Harris,
Nice to meet you.
hi.
Hello.
Hi, Kim.
Hello.
Sit down. OK, so today it's vasectomy.
Yeah.
And the...
Sorry. I think this is so funny.
I find it funny.
I seem to,
Because
don't
I
I?
went through labour and everything like that.
That's
so.
usually is. It's sort of like that payback type thing. Yeah. I'm just going to whiz through some of the final details. So it's irreversible. You don't want to father any more children.
No, 4's enough.
OK. 4 is enough, yeah. I've got 4 and 4's plenty. So what we're going to do today...
I'm getting too much dry out of there.
You are, aren't you? And we examine you to separate the sperm cord from the rest of the cord, the arteries, the veins. So that's why we don't expect any complications related to your testicles.
That's fine.
Yeah. You might feel a bit of dragging in the groin, and that's so that we can operate through a little nick in the midline. We then wash you down, do the same again. When we get the tube to the midline, give you a local anaesthetic injection. That's to the skin and to the tube. That lasts about 5 seconds. With a heat device, we just open the skin. We block off that tube, and we'll let that side go back. We then have a nick in the midline that we're left with. If it's dry, even if it opens a little bit, we just leave it alone to scab over. OK. If it's oozing from the edge, we'll put a dissolving stitch or 2 in, and they'll just drop out after about 10 days, 2 weeks. And we want you to rest up for a couple of days, take it really easy. And for the rest of a week, no heavy lifting, charging around 5-a-side, anything like that.
OK.
So what's your job?
I work for Yorkshire Water, lift heavy chambers and go under the ground.
You need like a note. though,
I'd need a
just to-
note to say that to my...
Right, OK. We can give you a note for that.
Can I be there while it gets done or no?
No.
No.
I really want to be.
We generally ask you to wait in the waiting area, yeah, if that's OK. Are you happy with the consent?
Yeah, that's fine.
You were there when I
I
give
think
birth.
it'll just wind him up.
I know, yeah.
Yeah.
But you were there when I give birth, so...
Yeah, and I supported you through it. I didn't laugh at you.
I didn't feel supported.
Yes, you did. You said afterwards that I was very good.
All right.
Right, we're going to let you go out to the waiting area, Kim, and we'll get Luke's gear on, or gear off, should we say.
There we go.
Enjoy yourself.
Yeah.
Yeah.
See you later.
So if you just have a sit and wait
I've had a shower last night.
About 20-25 minutes.
All right.
All
no
right.
worries.
OK, what I want you to do now is to take all your things off and then just put your arms forward into the gown, but don't fasten it up.
Right, yeah.
OK. And then just come and have a lie back on here. Is that OK?
Yeah, yeah.
Ready when you
There you go, and I'll just raise the bed up.
We're just going to examine you first.
Yeah, OK.
And then just relax as best you can. So just a little bit of catching that you feel.
Right, Mr. Wynne, I think I'm seeing you for something on your scalp.
Lump just there.
Right, just a bit warm and wet.
Okay.
Right, Dom, this cyst on your neck, how are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Oh, yeah.
Nice and still for me. A little scratch.
Tell me if this feels sharp.
A little bit deeper, but nice and still.
I bloody hate needles.
I've not met a cyst yet. I've been beaten by...
There are millions of sperm, and we've got to get that down to none.
You need to have had 24 ejaculations before producing your first sample for testing.
Could have been busy.
Yeah, I've got 4 kids as well. Do you want me to say it gets easier?
Please, yeah.
Yeah, it gets easier. Do you want the truth?
It doesn't. It gets harder as they get older. That's what I've heard.
Yeah, get more earache as you get older.
How many of these do you do a day then?
Yeah, we'll do 5 in a session in the morning or 5 in the afternoon. Can't do it all the time. The whole of Bradford would be sterile, wouldn't it? Can you imagine? That's just quite a nice variety for me as well, as GP. Bit warm and wet. Okay. Just washing you down now. You okay? Yeah. Okay, keep nice and still for me. Little scratch. You're doing fine, well done. Once you get the anaesthetic in, it all just calms down. A little bit deeper, just bear with this. Well done, that's great. Imagine how bad it'd be if Kim was in here.
She would be loving this.
She would be laughing her head off, wouldn't she?
She'll be out there now messaging all her friends.
Just bear with this while I just put this little clip on. Well done. Well done. How does that feel?
A little bit better.
Yeah? When I press you there, is it okay?
Yeah, it's fine. I don't feel up.
I think that's the worst bit over with.
Good.
Right, we're moving on to the right side now.
Okay.
This is where you'll feel is just getting the tube into place. So again, just bear with us again.
Okay.
You're doing great.
Thank you.
Well done.
You all right?
That's great.
Yeah.
It's another local anaesthetic injection.
It's fine.
And again, just bear with this, and then once that kicks in, it'll all just calm down.
Yeah. Worse than childbirth, this.
I dare you to tell her.
I've got to live with her, so I think I'll keep that between us.
She would kill you. Well, we are finished, and it's all gone very well.
Good.
So just wait where you are. Now, most people, you want to pull your pants, yeah. Don't jump off because you're a bit high up. Yeah. Most people, well, about half need nothing. The other half will take paracetamol. Yeah. Occasional people use something like a cocodamol or something like that. Yeah. But usually you're fine, yeah? Because you're resting up as well, aren't you?
Yeah. Well, I hope so.
Yeah.
Wherever she lets me.
Give us your gown, that's fine. Feel okay?
Yeah, feel fine.
Great, well done. Thank you, Whitney.
Are you done?
Yeah.
Well done.
See ya.
Let's see what she's like when we go out.
She'll be laughing away.
Come in. Hiya. Hello.
Hiya.
Take a seat. There's room for all of you. Hi. Who's this lady?
Nana.
Are you Nana? God, you don't look old enough to be a Nana.
I get all the time.
You're Chelsea's mum.
Yeah.
Wow.
She's my youngest.
Right. Who am I doing? Alfie. Right. Tell me all about it.
He went swimming. He's got swimming lessons.
Yeah.
He did them for a full week. He's been non-complaining that his ears are hurting. He's been sick. He's got blood from his ear. He's been screaming. So I brought him here, and they said he had fluid on his ear, and they don't know if it might turn into an ear infection.
Right.
So I've left it, and then it just got worse, and he was complaining. I called 111.
Yeah.
And then I phoned health visitor, and then I just left it because he seemed to be. He didn't seem to complain. Yeah. And then every time I give him a bath, he's like, my ears are.
Right. Let's have a look at these ears.
Stand up.
Come here. Let's have a look at you. You've got a lovely shirt on. You've got some cars, haven't you?
He just is.
Is it one particular ear or both?
It's both of them. Settled for like a day or something. Then he just kept, my ears hurting, and I was like, let's keep an eye on you.
That's really good, aren't you? Clever.
Because he's had it for so long, I just like to see how he goes first.
Yeah. And he's obviously if he's under hospital, if he's got grommets in.
Yeah.
Yeah. When did he last grow?
He went to see his surgeon a few months ago, and they said that if it carries on, then Bradford will put grommets in, but the grommets have caused the blood clot in his ear.
Right, now then. There's no Innis canal now. Now today, they're dry inside. There's no gungy. There's nothing wet at all. I can press round them. When do you next go into hospital?
A year.
At the moment, it's nice and cool. There's no gunge. There's no bulging of his eardrum. So it's really... There's no real reason for me to give him any antibiotics or anything.
Not yet.
Unless there were anything serious to do.
Yeah, that's fine, no worries. And then do you know what he said? He laid me down and he says, right, I'm just going to clean you down now.
What did he clean?
So I was like, down there, and he had like hot water and he was like fixing it up and then rubbing it.
What? Rubbing what?
What do you think?
Did you?
Yeah. Well, she went in the room watching, so I'm just like, so I said, do what I said to her. How did you get into this line of work?
Mrs. Varner Cowley? Mrs. Cowley, you were due to see Dr. Crampton, but she's stuck with a... Well, not stuck, she's managing an emergency. Are you OK to see me instead?
Yes,
I'm Dr. Khan. OK, come and sit down.
Thank you very much.
Right, so I'm Dr. Khan. How are you?
Yesterday, people kept saying to me, what's up with your eye? I didn't know. During the night, this part was really hurting because I sleep on that side.
Yeah.
And it's burning.
OK. Any problem with the vision out of that eye? Does it feel the
Not
same?
that I notice, really. And I think it's watering, but it isn't.
Let's have a look. Do you mind if we just take the glasses off? I'm just going to have a closer look at it. It is very red, isn't it?
Yeah.
OK, so if you look up at the ceiling for me. And just down at the floor. And then up again at the ceiling. OK, and I'm just going to do some tests on your eye. If you just follow my finger with your eyes only.
Yeah.
Any pain in that eye when you're looking over to that side?
It's just burning.
Burning,
not
yeah.
any other... Yeah, same.
OK. Right, if you just put your glasses back on, and then if you just cover your good eye with that side, what does your vision feel like there?
It is a bit blurred compared to normal.
OK, I just want you to keep looking at me. When I move my fingers, I want you to say yes. OK. We're going to try the same on the other eye, so let's do that. And then look at me again. When I move my fingers, say yes.
Yeah, I can see them now.
When you've got pain around the eye or any burning, it suggests that the bleeding is going from the surface of the eye but to behind the eye as well and inside of the eye. That can cause pressure to go up inside of the eyeball because the eyeball is a nice kind of ball and it's full already. There's no room for anything else.
No.
And if there's any bleeding, extra fluid inside of there, then it starts to raise the pressure and that can really cause problems with your vision.
Yeah.
The pressure is already getting to a point that it's damaging the nerve in the back of the eye. So we need to get you seen urgently today by the eye specialist.
Right, Ashley, are you getting out of this pram because it's your turn to be seen next, sweetheart?
Oh, my God. That's a copy of your letter, but just to show you, but I will refer you.
That's fine.
Come on, which one do you want, where do you want to sit? Are you going to come and stand in front of me? Hello, beauty. How are you? Right.
She's had a cough for quite a while.
Yeah.
She's spluttering. She's got a sore throat.
Right.
But it's not... The cough doesn't seem to be going.
And Debbie, put this in your ear.
She's also got diarrhoea as well.
Hey, mate, come here, come here, Nanny.
Come here, sweet.
Look, here, do you want Nanny's phone? Here.
So good girl. Can you open your mouth really wide for Daddy? Really wide, open wide. Oh, are you clever?
Tell her to go back to school next week and I don't want her to say, oh, my chest hurts, or she's wheezing. I was like, no, it's not
stand
happening.
here then, your mum and your nana can see you. So she's breathing beautifully.
Yeah.
Nice and calm, no pulling in. Her chest is lovely and clear. She's not pulling in or anything. She's got no glands. Her temperature's 37.5, which isn't really a temperature, but it's just up a right little bit.
Yeah.
And her throat's a little bit on red side.
Right.
So this, that in line with a runny nose and a little bit of diarrhoea makes me think she's got a viral illness.
Right.
That will settle on its own. Plenty to drink. Calpol, if she's hot, might spread to these two. That's the problem.
It's fine.
You're beautiful, aren't you? Eh? Are you looking forward to seeing your friends again? At school? Is he going to school?
Yeah, reception.
Oh, you want what to do? Yeah. Alfie, have you got a uniform?
Yeah.
Have you got a uniform?
You look very cute in it, don't
I
you?
bet you look very cute in it.
Nothing.
I don't believe you. I don't think there's aught wrong with your blooming earring there. Oh, you're doing a good job. Are you proud of her?
I'm very proud of
Yeah.
her. I've been a bit stressed over the last few days because I've been at my house for the last couple of days having a bit of quality time with Nanny.
Listen, as well, you worry about your children all the time, but try and look at them and think, God, haven't I done well? They're great.
Mwah.
You enjoy that time when they're at your mum's and when they're at school, because you won't get that time back. It's lovely.
I can't wait till they
You're
go
going
to
to say
school.
bye-bye?
Bye, kids.
Thank you.
Say bye-bye, love.
I felt better, but this morning, well, I woke up a few times during the night and I had this pain down the side, burning, and I thought, well...
I'm just a bit concerned you might have this other condition called an acute glaucoma, where all of a sudden the pressure raises in the back of the eye and causes that nerve problem. Nobody really knows why it happens. There's lots of different theories, but we don't know why.
Like
Ladies are more prone to it, unfortunately. Let me ring the eye hospital. We'll get you an appointment there. They'll see you today. Oh, I'm so glad you came today, because any kind of pressure in the back of the eye can lead to permanent sight loss if the nerve gets damaged really badly.
I've never had anything like
No.
it. And that's my best eye.
That's your best eye, so we need to keep it your best eye.
Yeah.
You're the most unwell patient I've seen today. I know you don't feel unwell, but this is a really serious condition, so we've got to get you seen by the eye doctors ASAP. Hi, my name's Dr. Khan. I'm calling from the Ridge Medical Practice. I've got a lady who's 74 years old. She's coming with an acutely painful left eye. It started yesterday, red bloodshot. She's got painful eye movements, pain inside of the eye and above the eye, and a burning sensation on the surface of the eye. On examination, the pupil on that side is sluggish to respond to light, and she's lost her visual fields on that side as well. Pretty worried about her, to be honest. Will it be today, though, her appointment? I'm really reluctant to let her go home, because even while she's sitting here, her vision is deteriorating. We need to get you seen today. I won't take no for an answer, don't worry. If it's all right, I'd rather her not leave the building until I've heard from you, because I need her seen today. Yeah, so will you call me on my mobile the minute he's free? Yeah, all right, thanks very much. Cheers, bye-bye-bye. Mrs. Cowley, I'm going to have to hold you prisoner here.
Oh.
No, the eye doctors are in theatre with another patient.
Yeah.
I don't want you to go because I'm worried that minute by minute your vision will get less and less.
Like my eyes are burning.
There's discharge from the eyes. When he wakes up, they're literally glued shut.
So I get a little, like a mist.
The lashes, they are a bit sticky there.
Did those drops help that I gave you?
Stare in the middle of that door for me, David. You're going for your eyes tested, are you?
Well, I want to do.
Regarding the eyes, we see that there is some infection there. Okay.
Well, these are good enough. Look at these. Look like I'm in Top Gun.
Hello, love. Listen, I'm at doctor's. He's keeping me prisoner. He won't let me go. It's dangerous. It's very urgent. OK.
Mrs. Cowley?
Doctor's called me. I'll give you Jeffrey. I was just talking to my sister.
I'm glad you're still smiling, Mrs. Cowley. Come on.
Well, there's no point crying,
No
is
point crying, it's true.
Thank you.
Sit down. So, the eye doctor's rung me back. He's equally worried about you. He's in theatre all morning today. He's booked you into his clinic this afternoon at 3:30.
Where is this at?
At the BRI. I'll write it down on here. They're going to see you urgently, and if you take all of this with you, it's got the letter that I've written.
Right. Have you done all that already?
I have. Very organised.
I'm watching you.
So just take an overnight bag in case they decide to keep you in hospital.
Okay.
So take all of that with you, and then once everything's fine, will you come back and tell me how it went?
Will.
Yeah, I'll be interested
and
to know.
Thank you very, very much.
My pleasure.
Thank you very much.
My pleasure. Oh, 2. We're very exotic.
Us Italians like kissing.
Yeah.
Thank you
All
very
right,
much.
cheers.
Bye-bye.
Just go through there, Mrs. Cowley.
I want to go to the toilet.
Oh, fair. I'll allow it.
Morning. Come on in, have a seat. Right, I'm Dr. Caris. This is Caroline with us today.
How do you do?
All right, thank you. Right, something on your back, is that right?
Yeah, I've got a cyst. Yeah.
Tell us a bit about it.
I've had it for a couple of years. It does fill up, and then when you lean back on a chair, it's tender.
Does it leak and discharge?
Well, I end up getting to squeeze it. Yeah.
And then you get sort of cottage cheesy
That's
type
right,
stuff
yes,
out.
it stinks,
yeah.
yes.
Smelly, isn't it? Right, and,
Yeah.
and you're keen to have it removed?
Well, I've had it a couple of years. I want to get shut of it now.
Right, would it be all right to have a quick look
Yeah.
and an examination, and then we can have a chat about it? Do you mind if we just lift this up? This is it in the middle, isn't it?
Yeah.
Is it all right if I just have a gentle examination? And when was the last time it leaked?
About 3-4 months ago.
OK, so a good while back. You can see the little head on it, can't you? Yeah. OK, that's fine, right, thank you. So, these things are very, very common. Most people, at some point in their lives, will get one of these somewhere on the body. The scalp and the back are the two most common areas, and they're just a blocked oil gland, and we've got oil glands all over our body to keep us waterproof. So what would involve is numb it with an injection. That does sting a touch, OK, for about 10-15 seconds. Cut over the top of it, shell it out like a pea in the pod, and then put some stitches in, OK. Grand. Right, you don't mind us if we just lift this right up? Perfect, yeah. So the injection does smart a touch, I'm afraid.
I gathered it would do.
But only for 15 seconds max, probably. Right, are you set? Here we go. 3, 2, 1. Touch more. Right, just give that a bit of time to take effect.
Well, that wasn't as bad as what you were making out.
Yeah, I wondered sometimes if I do overplay it a little bit. Any of that sharp? How's that?
Yeah, I think you're all right with that.
Not sharp. So how long have you had this one for?
3 years, I think. Maybe a little bit longer.
Hello there.
Hiya.
Come and take a seat, sir. Mark Russell.
Yeah.
What can I do for you today?
I've got a recurring bad back. It went away when I got some painkillers and some anti-inflammatories, but it's just come back again. It's come back in force this time. Because my legs, I've got pins and needles in my arms and pins and needles in my feet.
So tell me more about your back pain. When did it start?
About 4 or 5 days ago. I hadn't had sleep for 4 days.
Right, because of your back pain?
Because of my back pain.
We just have a feel of your back, so if you take your coat off for me, please. How does that feel when I'm pressing you?
That's okay there. It's when you get to there.
Right. So if you just lie here on the couch for me. Right, I'm going to lift your leg up. What's happening when I'm lifting your leg up?
It's pulling up back.
Both sides?
Yeah.
Right, let's bring you back up. Yeah. Okay. You all right? What's happening to your breathing?
Just getting right tight.
You suffer from asthma normally, don't you? Have you been having your inhalers? Yeah? You having any chest pains?
Just this, see.
So just come and take a seat. What do you do for a living?
I don't work.
Right.
I'm permanently sick. Take me out.
Right. How's your breathing now?
Still the same.
Same?
Same, yeah.
Let's put this on your finger. We need to be clear on this. How's your breathing now? Because if your breathing's not getting better, then I'm going to have to send you to hospital. Because I don't know what's causing you to be short of breath so quickly. Do you drink alcohol, Mark?
Yeah.
How much do you drink?
Just 4 cans, that's all I have.
4 cans a day?
Every so often. They don't have them all the time.
Do you use any street drugs at all?
Yeah, I do.
Right, what do you...
Speed.
Speed, right. When was the last time you had some?
About a day and a half ago.
We need to be very clear on this, Mark.
Yeah.
Yeah? If your breathing is off And if it's become off very quickly, that means I'm going to have to send you to hospital. So you need to tell me clearly, do you think your breathing is an issue for you?
Yeah.
Yeah? Okay. Would you be happy if I called an ambulance for you?
Yeah.
Yeah?
I'm better off. I don't feel well at all.
Right. Give him a call. Oh, ambulance, please.
Key to it is getting all the lining out to try and stop it coming back. It's just what I'm doing now.
Well, I don't want it coming back, but...
No. They're not much fun, are they?
No.
You okay there?
Yeah, fine.
Good, it's coming out nicely in bits and pieces, which is what I was expecting. I think we've got all the lining out now. Good. Couple of little absorbable stitches and then you'll be home in time for breakfast. Second breakfast.
Oh, no.
Do you not have a second breakfast?
No.
I try and have a second breakfast whenever I can.
A cup of coffee.
My second breakfast usually starts before I go to bed at night.
Non-stop eater.
Unfortunately.
A grazer.
I like to graze as well.
Yeah, I just can't. I've got no willpower when it comes to food.
What would your ideal second breakfast be?
Bacon butty with an egg, a runny egg, brown sauce.
If it goes in a tea cake, I'll eat it.
So these stitches absorb from the inside out.
Okay.
So the last thing that goes is the knot. It usually takes about 3 or 4 weeks. Tiny little nick, but we've managed to get it all out through a little, like keyhole surgery almost.
That's fine.
We're not going to send anything off to the lab to get analysed because it all just come out in piecemeal and it certainly was a little cyst.
Yeah.
We'll put a little dressing on now, which he just asks you to leave on for 24 hours and keep it dry for that period of time. OK? Any questions you want to ask?
No, it's fine with that.
Grand. Right, we'll just lower you down and you can sort yourself out, get your cup of coffee.
Ooh.
She does a good breakfast upstairs, actually. There's a little cafe upstairs. OK?
Right, yeah, thanks very much.
All right, we'll leave you to it then.
Cheers,
okay.
thank you.
See you later. Bye-bye.
Let me put this on and check your blood pressure as well. Let's put this on your arm. This arm. I can smell a little bit of cannabis on you. Do you have any cannabis at all?
I have had.
When did you have it?
Last night.
Last night. How much did you have?
Not a right lot.
Right, what's not a right lot?
About 1 cigarette and that's it.
A cigarette?
Yeah.
I can smoke quite a bit. Your blood pressure is perfectly normal. How long have you been smoking for?
I haven't been smoking, don't smoke.
And at what speed?
I've been doing that for the last 25 years.
Have you ever thought of cutting down at all?
I go to a mental health
Yes,
place.
I know. I've seen your notes, yeah.
It caused me a mental breakdown. I've got much on my mind and everything. I've tried loads of times to stop, and I just can't.
You told me a little bit about what had happened with this on your eye.
Yes.
Yeah, skin cancer.
It just swells up and it's as sore and as tender as anything.
Tell me what happened with your skin.
All of a sudden, it's like you just get up one morning and what's happened?
We'll have a look at both these areas.
They don't know how far it's gone inside the eye.
Yes.
Has it helped as cream?
And I couldn't take my cap off and it stuck to my cap and it all came off in my cap and it's left a hole.
Ah.
He's got a bit of a rash and he's itchy, dry.
Any rash anywhere else?
It's a bit unusual.
Mandy, that's me, innit?
You're ticklish, aren't you?
Come on in, eh? Have a couple of seats. Hiya.
I won't take that seat.
No, you can if you want. We can switch around. Right. What's going on?
I have a lump here that I'm advised to have it looked at.
OK.
Sometimes it itches like flipping crazy.
Does it?
Yeah.
And how long have you had it for, would you say?
I'd like to blame Brexit, but I've had it about 10, 15 years, something like that.
Yeah, it has grown a little.
Started as what I thought was a spot, and then it just developed into this lump.
Does it ever bleed?
On one occasion it has bled, yeah. That could be when I was trying to get rid of it by rubbing it a bit and washing it extra. And...
Right, OK, but it doesn't bleed by itself?
No.
No, OK. And have you tried to sort of to squeeze it and get rid of it and things, or some people are tempted to poke and prod and
not particularly.
Get the Stanley knife out and things like that? But no, you're not doing that? No, good.
No, the Stanley knife, no.
Excellent. And have you ever had any skin problems like this in the past?
I have had a cyst removed from my chest, actually, which...
Oh, did you?
I had that removed because of the smell. The smell permeated.
I know,
and it was a terrible smell. And I watched him dig it out, and it was a yellow pus, and it was terrible.
They're not much. They're not nice to have those, are they? Would it be all right to have a closer look and a gentle examination and things? Right. I'm just going to put a bit of this jelly on. You don't mind if I just...
No, help yourself.
You don't mind? Is it sore to touch?
No.
Right, and this is just a magnifier with a little bit of jelly, which gives us a better idea. OK, thank you very much. Your doctor was concerned it might be a type of skin cancer. I don't think it is. I think it's an overgrowth of one of the layers of the skin, like a type of mole, if you like.
Right.
You've had it a very long time, and it's very, very slow growing, and skin cancers tend to grow a little bit more quickly, but I don't think it is when you look at it down the microscope. And I don't think we would be able to remove this on the NHS, unfortunately, because it would be deemed cosmetic. But if you did want it removed, I think there are options within the private sector.
Not at the moment, no. I'll put up with the itching.
Why does it get itchy? Sometimes it can just get a little bit inflamed. Some of the cells that are in there can get inflamed. And once we get an itchy patch, we often scratch it without knowing, and then that makes it a bit more itchy and things. So sometimes a little bit of moisturiser, if it gets a bit itchy, might just settle it down. Is that all right?
That's fine, yeah. Fine.
Great. We'll leave you to it then. Thanks for coming in. All right. Have a good day. All right. See you later.
Bye.
OK, bye-bye. Obviously, if things do change in the future, please do get checked out, because things can change. But here and now, I'm not worried.
OK, thanks
all right.
very much.
See you later. Bye-bye.
How's your breathing now? Better? Calm down, isn't it? Yeah.
Some panic attacks as well.
Hi there, guys. Hi there. Right, we have Mark 51. He came in for a back pain, and it seems like having a panic attack. It looked like so his heart rate went quite high, and became very short of breath. He has been taking some drugs. He's been smoking quite heavily last night, by the seams of it. His heart seems to be calming down now.
What was his rate?
So he went up to 124.
124?
Yeah. Came back
Is it just weed you've been smoking, Matt? Marijuana?
I don't smoke.
All right.
I was sat in the room with them.
Well, they were smoking.
Yeah.
What were they smoking?
Marijuana.
Yeah, it's not like quite, yeah.
I've been taking amphetamine as well.
You still got that pain now?
Yeah, just a bit.
I'll just do this quick ECG, make sure nothing's going on with your heart, and then we'll get you to ambulance, all right, buddy? Just means putting these stickers on your chest, all right? Lift up that, is that all right?
I've lost loads of weight since the last 2 months anyway. I've just been so stressed out and depressed and not eating properly. And...
Well, since I've seen braces.
I'm fed up with my pants falling down. And I've got a flat cap as well.
Oh, yeah. All you need is a whippet.
I've got one.
You got a whippet? Right, keep really nice and still, all right? Just for 2 seconds, no talking. Yeah, apart from being a bit fast, it looks all right, Matt.
All right.
All right. Any heart problems in the family? Or?
Yeah, my mum.
Your mum?
Mum died of heart attacks.
Was she over 60?
Yeah.
Yeah. Having difficulty breathing when you came in? Pins and needles in your hands, anything like that?
In my legs.
In your legs?
And in my hands.
What about in your face?
The side of my face.
Yeah, sounds like a panic attack. We'll get you checked out. Right, Marky, you want to get your stuff ready?
Thank you very much. All right, Mark, we'll see you once you're out of the hospital.
Yeah.
All right.
Right, thanks a lot.
All right.
I smell something right weird. Have I stepped in something? Can you smell something?
Is it a bad smell?
Mmm. It's not me, is it?
No, you smell nice.
Come on. Come on, sit down.
Thank you.
How you been?
Oh, not too bad, not too bad.
Good.
I got your text this morning. What's been going on?
So we'll have a think about things, because last time you came in, you said that you'd had this fuzzy feeling in your head, really. And you were worried about it
Non-compass mentis, I call it.
Well, yeah, it's a posh word for it. You were worried it might be your medication. But actually, when we looked through your notes, you'd thought that before for other medication, and we'd stopped them, and the symptoms were still there.
Right.
So we did some blood tests, which, to be fair, have all come back clear, so all normal. But it leaves us with the question of why are you having this feeling?
Okay.
How long do you think you've had this fuzzy, woozy feeling for?
2 or 3 months at least, yeah.
And then tell me exactly what it feels like when it happens.
Well, as if you've lost track of everything. You're walking down the garden path from the greenhouse to the house, and all of a sudden you just go like that. What was that about? You just do that bit of a stagger. Yeah. And I thought, well, I haven't been drinking.
Is your speech ever affected when it happens?
No.
What about your arms or your legs? Do they feel weak ever when it happens?
Pins and needles, yes.
OK. Tell me a bit more about that.
From that point there, and here, I can feel it coming now.
You can, yeah.
All down this side here. But every now and again, I go into cramp.
That might be a separate problem as well, but we'll have a think about that.
Blimey, how many problems have we got?
Oh, yeah, well, you've only got 10 minutes. Use them wisely. No, I'm only joking. Do you ever get forgetful at all?
Yeah.
You do. We have to think about what is causing this. Is it just normal ageing, and as we get older, we do become a little bit forgetful?
Oh, yeah, totally.
Or is it something more than that? I don't think it's anything like Alzheimer's, dementia, or anything like that. The other thing that it could be is something called vascular dementia, and it's not the same, but what it means is you might be having, we don't know for sure, tiny little strokes.
Yeah, I had thought about that, but I mean, you just don't know, do you?
You just don't know, but there is one way to find out.
Ah, right. Well, I'm game for that.
To get a scan of your head and see what's going on the inside, and then we can go through the results of that together.
Right, OK.
Does that sound fair to you?
I'm all for it. I keep pulling the leg of a lot of people. I say I'm 93. I want to try and get there if I can.
We'll work on that together, shall we?
Thank you. Bye. All the best. Bye-bye now.
You too. Bye.
Bye.
All right, Mark, so I'll see you next Monday, yeah? 12 o'clock, yeah, here.
Thank you very much indeed again.
Thank you again,
Okay.
Mrs. Ingham.